Hello and welcome to day 2 of our Lifestyle Medicine Summit, Global Summit 2024. How is everyone? Type in the chat box. Always love to hear from you. Give us feedback from yesterday. Who did you like most yesterday? I mean, amazing conversations and controversial also, enlightening, and a great panel. American College of Lifestyle Medicine present today again. We have amazing speakers that really, and today, by the way, is really about what the summit is about. It's about the evidence-based lifestyle medicine. And I want to start with that. So my presentation is going to start in a minute. Meanwhile, I want to just make sure that everybody's okay, settle in, have something healthy to drink. And again, watch as much as you like. That's why we offer the summit for free, to educate, to bring together a global community about lifestyle medicine and health coaching, and really fulfill our mission as a nonprofit, which is to make lifestyle medicine and health coaching accessible to everyone. Who is joining us? Who wants to join? Who feels like this is needed? We need to solve and end the chronic disease epidemic. And the best way to do that is obviously by now evidence-based lifestyle medicine and health coaching. So type in the chat box where you're from and tell us a little bit about yourself, just so we know who's out there watching and that we're not alone here. It's always interesting when we have presentations online. You wonder how many people are watching and where they're sitting and what they're doing, right? It's just great to hear from you through chat. So that's the engagement on your side. Ask questions. I have about a 20-minute or so talk, and I can answer your questions, and then we go into really great conversations with experts in lifestyle medicine. Day 2. Okay, so let me see. I think I'm going to start right away with my slides because I want to, let's get the slides up if that's possible. Perfect. Now, when we talk about lifestyle medicine, I hear many times, like, what is it really? Yeah, I kind of know what it is. It's about lifestyle and medicine. But what are the parameters? What is it really? Why do we need it? What is it about exactly, and how do we get involved? What are the specifics, right? And that's what I want to do today, summarize what evidence-based lifestyle medicine is with a little twist from Lifestyle Prescription University, how we also teach it. There are slight variations how different groups around the world teach it, but there's a core that I think we all agree on, and I want to share that with you, and then make you think, like, is that the best way to actually implement lifestyle medicine? Because this is two different things, right? We learn how to use the 6 pillars of lifestyle medicine and the 6 root causes, as we're calling them. We learn about that. We know this is to be true, but then how do we implement it? And especially like yesterday, we talked a lot about public health. And let me go to the next slide here. Right? You've seen this probably yesterday, but I mean, in a way, these are depressing, right? If 80% of adults have chronic health issues, kids, youth have tremendous amount of chronic health issues from, as you can see, a high blood pressure, obesity, diabetes, high cholesterol, Alzheimer, right? Depression, anxiety, addictions, right? These are major all over the world. Not much of a difference, really. And in terms of the budget, if what 80-90% of the budget that we spend in terms of healthcare goes towards managing, not resolving, not healing, not reversing, but just manage chronic health issues. And we all know that's unsustainable. And the big question, obviously, that I think all of us health coaches, practitioners, and you as someone that maybe has chronic health issues, you ask yourself very likely, so why is this happening? What are the root causes? What's causing this, right? And which I think is the essence of lifestyle medicine, to get started on that, is about where can I get the support to actually help heal and prevent, reduce, and reverse chronic symptoms. I did on X, Twitter, I think a half a year ago, a survey. I asked, how satisfied are you with healthcare? And we did this yesterday. Everybody gave really low ratings, right? But I asked, where and how do you get the support in terms of specific support from a healthcare professional? Is it easy for you to get that support, or do you have to basically just figure it out yourself? And I think 95%, I think 97% said, I have to figure it out myself. And that is great, but the reality is that excludes probably a vast majority of population that does not have the resources, the time, the knowledge to implement these lifestyle medicine principles by themselves, just by taking charge, which is a good thing, very important. But my point is, we have to think about, how do we implement it? How do we actually make it available for everyone? And I think healthcare professionals, from physicians, family physicians, all kinds of healthcare providers, they are, I'm calling them out really. Hey, study lifestyle medicine and use it in whatever capacity you can. Okay, so this is kind of like a definition. We updated it a little bit, but I like that one because that is the action-oriented part. So obviously we have 6 pillars, 6 aspects of lifestyle medicine, 6 protocols that I'm going to go into in a second. But to me, this is what it's about. Evidence-based lifestyle medicine is about coaching, supporting patients and clients to improve their lifestyle habits to prevent, reduce, and reverse their chronic symptoms. Now, a few highlights. Lifestyle habits. Type in the chat box if you would agree with me that we can read hundreds, thousands of books about healthy living, right? We have all the information we need. Some is very confusing, right? It can be opposites, and that's the thing. But is information enough? Is information enough? Do we actually, if we read a lot, for example, which is good to educate ourselves, but isn't actually making changes to our habits, our lifestyle habits, isn't that really what we need? And that's the hard part. I can read 5 books about improving my diet, but am I really doing it? And that's where the support comes in, the coaching, right? Even us, I mean, myself even, right? And many of you that are in this field, you notice like it is not easy to make these lifestyle changes, just trying to do it ourselves. And that is, I think, what, in terms of healthcare, all of us, we have to demand that support. And there's many ways how to do that. So improving our lifestyle habits, but 2, as an outcome, to either prevent chronic health issues, which likely means we live better, we have more fun in our life, we have better relationships, we live longer, right? All these incredible benefits. If we have symptoms already, to reduce them. So instead of having a pain in my shoulder that is 10, that is so severe, I bring it down to maybe a 5 or a 2 or a 1. Or reversing it, that the shoulder pain just disappears. These are the 3 options, really, right? So, and at Lifestyle Prescription University, we try to be very precise, because I think that is still lacking, that we know actually how our body works in terms of the organ, mind, brain, psychosocial connection also to our symptoms, and be specific when we work with clients, helping them to improve, ideally with a micro habit, something small, or something that grows into a substantial lifestyle change. Okay, here we go. You have this, and I later on I give you the link. Oops. You probably have this already. It's a worksheet we created that is meant for healthcare professionals and for anyone that says, oh, what is lifestyle medicine? What am I going to do here, right? A guideline, a visual guideline. And I go quickly through it. Many of you probably have seen this or have heard me talk about this, but it grounds ourselves in terms of what is it we want and which options do I have as someone that has chronic health issues? Which options do I have? So basically, these we know, right? We do nothing, we observe and procrastinate and say, oh, it's going to get better, and all these things all of us do, right? Oh, the pain's going to go away. And then 3 months later, it's still there. It grows, expands, right? So that's the worst option. Please don't do that. I mean, find ways to engage and prevent and become aware and take advantage of options as soon as you have symptoms, to start early on and not let it drag on for 20, 30 years. This is number two here, we all know about. This is like, what, I don't know, 80, 90% of healthcare right now, trying to treat it. And I hope you guys don't mind if I say that the managing chronic disease is a mindset, right? And that mindset we find not just in traditional allopathic medicine, right? We wait until it's too late? That's typically what I say. Somebody comes in, and then what do we do about it? And we can have allopathic, we can have different techniques, like different traditional medicine methods we use, but many times natural, complementary modalities have a similar mindset, that actually we just prescribe, instead of a painkiller that is allopathic, we have a remedy that is natural, but it's the same mindset. We focus on the symptom, right? And that is changing with lifestyle medicine and holistic type of medicines. There are a couple of versions of that. So very important, I think, to look at the difference. We want to address the root causes, what is really going on, and go beyond the symptoms. In lifestyle medicine, right, symptoms are symptoms. They show us the imbalances. They're signals, signposts. And so the number three here is that, and these are options we have as individuals, how we want to deal with our chronic health issues. And by the way, I say it again, and I say it about 100,000 times if needed. Ask your doctor, ask your healthcare professional, say it about as many times as I say, ask them, do you offer lifestyle medicine? I want lifestyle medicine as my form of care to treat and manage, to prevent, reduce, and reverse these chronic symptoms. Don't just say, yeah, it's a little better, right? Demand a solution that actually allows you, maybe over time, to reverse as much as possible these chronic health issues. So what is it really? It's about lifestyle medicine, lifestyle as medicine. And the goal is to use these 4-6 pillars, and I explain the difference in a minute, to basically improve our immunity, improve our vitality, improve body-mind functions, and allow our body to regenerate and repair, which is a natural mechanism that our body is built to adjust to life situations, to repair, right? To basically regenerate, especially at night, our body's meant to regenerate. So how do we do that? So I'm using the Dean Ornish model, which is about nutrition, fitness, exercise, stress management, love, and support. Now, other models like the American College of Lifestyle Medicine, for example, has improving quality of sleep as number 5 pillar, right? And removing toxic substances as number 6, right? So same thing in a way. I just like simplicity, so I use the 4, or we use the 4, but 6 basically just separates the toxic substances, which are super important, and the quality of sleep, equally super important, as the 6 pillars. So the question then is, how do we do this? I mean, you might want to also type in the chat box, right? Is it, most of us know that, nutrition is important. All of us read a book, I'm sure. Fitness, we know for 20, 30 years. I mean, this we know for, 30, 40 years. And Dean Ornish is going to talk about that in his talk, I think, a couple of days ago, in 2 or 3 days. He has been writing books and doing research, and that's why we call him the father of lifestyle medicine, because he was one of the first, and with Bernie Siegel also, just in the 70s, 80s. Why is it that it's so hard to implement this, is one question. in healthcare in general, but why is it for us so difficult, right? And I think one aspect is for sure, we live in an environment where it is hard. Like we talked yesterday about that, for example, the unhealthy, toxic food system that we have, the intense chemicals and hormone disruptors in our food, the sugar, the corn syrup, and other substances that are highly unhealthy, to say the least, they are in our foods. And the thing is, I lived in many different countries, and I have to say, in the US, it's pretty astounding that so many chemicals, for example, that are not allowed in Europe or in Asia, they are in the food everywhere. And that's just, to me, is unacceptable, right? And that's why there's this movement that to end chronic disease epidemic is growing, because we all fed up. So in terms of the toxic substances that are everywhere, obviously that is already, if we just help our clients or ourselves, we pay really attention to what's in the food. We read labels, right? What's in the drink? Is there sugar per se, artificial sugar, that is more like a drug, right? And there are many different names for it, right? So we have to learn how to really pay attention to that. And as a healthcare professional, we obviously, what we want, help our clients, not just read the label and eat still the same thing, but basically to help them establish ongoing habits that automate. One of the things we work a lot, how we teach at LPU, is think about the iceberg or the Titanic, right? Like what 10% is above water, the rest is underneath. So it's the conscious versus the subconscious, the unconscious, the automation. If we know that 80+% or 90% of everything we do, the habits we run in our system, right? Like digestion, we don't pay attention, right? Like blood flow, everything in our body pretty much is part of this autonomic nervous system where it runs automatically. It's not conscious. So if we just read a book, or if we just consciously with willpower try to make a change in our life, that works many times, especially if you have strong willpower. But the tendency is that what's really the automation, the software programming in our system is running our system. So think about a hardware, right? Or a smartphone, that we have to often, if there's a bug, so to speak, in our software, we have to update. We get an update, right? And are we doing that? Are we updating our own habitual habits on a regular basis, which requires to be conscious about it, this is not really, I always go to the sugary thing, or like at 3 o'clock in the afternoon, I always get coffee, right? These little things in life, we pay attention to them, and then in our minds we say, okay, what's my new habit? What's the new habit that I install in my life? And obviously with support, it's a lot easier, because there's super good tools we can use to basically help with the installation of a new healthier habit into our system. And I go into that in a minute more. So type in the chat box which of these 4, or if you want to make it the 6, removing toxic substances and sleep as 5 and 6, which of these habits are more difficult for you to install and implement? Make a list right now, and you can put it into the chat box, or just write down a piece of paper, right, where you kind of write a journal and say, why don't I, for the next 7 days, I just monitor. I'm very conscious about what is it that triggers me into a certain habit. What's the craving, right? What's the habit actually? Like, I just evening when I'm feeling lonely after work, that sugar snack or a piece of chocolate is very comforting, which we call emotional eating, right? And then I just do that, and once I'm done, I become aware of it. Is, oh my God, why did I do that, right? That's the automation process. So the more we slow these habits down and become aware of them, the easier for us individually it is we are able to change them. I think making a chat comment here, I find that making the decision to not negotiate with ourselves is often effective, which requires awareness, first of all. Absolutely. Excellent. So let's dive a little bit into these different, and by the way, you can just read them. I'm not going to go into the details. A lot of you know this anyways. And nutrition, right, which is essential. It's like feeding ourselves, giving us the energy. Like, you know, think about if you start to have a mindset and say, and you can do this right now, you say, from starting right now, I'm like, be very conscious what I put in my body. It's not about being fearful, right? Many of us over these years, they started, oh my God, everything is bad, and the fear kicks in. No, 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 no. It is just about slowly or fast removing the things that maybe not as highly quality. It's about the quality of our food, right? Pay attention, remove the things that we know are not necessarily healthy. And it's better to, let's say, get rid of or substitute the sugar drinks, the soda drinks that we might drink daily with warm, hot, or water, any water, right? And you just focus on that. We're calling that a micro habit. Instead of saying, oh, I changed my diet and everything, which is a lot harder to do. And that's why many of us fail in terms of, you know, New Year's resolutions, because we don't have the support, first of all. And second, it's much more harder. It's much harder to basically make a big change and change everything versus you start building one habit at a time and add to that. Once you build your muscle, it's like a muscle that we need to build to improve our lifestyle habits. And you have here some of them. I just very quickly go through some of the easy ones, right? Eat moderately, improve the quality of your food, and all these create or require some form of awareness, right? We just pay attention. Integrate intermittent fasting. Type into the chat box if you'd like. How many of these do you actually practice already? Like intermittent fasting could be like 12 hours no food or drink, or, you know, like say from 8 o'clock in the evening to 8 in the morning, or you do it even 16 hours, right? Eat with awareness and pleasure, right? Do we eat just for survival? So we stuff something in because we're hungry. The body says I need fuel, right? Or do we consciously eat, oh, I have a health issue and I want to eat in a way that supports that body part or that symptom to disappear, to heal? Or do I eat for longevity? Very different. If I want to live longer and better, then I might have to really make other or more profound changes. So I live 5, 10 years longer and have a better quality of life, right? So we need to put attention to that. And again, we can read thousands of books on this. It's not what matters. What matters is what we practice, what we actually do. In exercise, you know, we find an exercise we do regularly that we love, you know. And one of the things we make sure love and support, we check where do we get love and support, connection, community in our life. Very important. And at LPU, we pay a lot of attention to stress management, which means, you know, especially the psychosocial and life stressors. And again, I talked about that in a minute. So am I using a stress management tool? And just 1 second here. When was the last time you had a conscious, deep, relaxing breath, or like a 1 minute of, and while you have the conscious breath, you feel every cell in your body like fill up with new energy, with oxygen, with prana, whatever we call it, G, life force. These little things, I never forget, one doctor said to me a while ago, said, you know, just for me, breathing a bit more consciously makes just a difference. It's crazy, right? So it doesn't always have to be this huge shift. Small shifts work very well and help us build the muscle. Okay, so as a physician, right, I encourage you as a healthcare professional to start prescribing lifestyle medicine. If you don't do it yet, obviously, please get to a training that is specifically for physicians where you learn this. But on the other hand, it's something you might just play with it right now. If a client has, let's say, talks about how bad their nutrition is, find in a communication, right? You communicate with the client. Well, what is it? A simple question. What is it you think you could do to improve that? Let the client make the decision, because then once they do, they own it. They more likely follow through, right? There's a lot of skills as practitioners, healthcare practitioners, that we can learn. Simple skills. It's not rocket science, right? It's something we can learn rather quickly to actually communicate differently with our clients, so they actually establish these habits. They trust us. They say, oh, finally, I can talk to these things about these things with someone. And then they start improving. Let them practice their habit. They come back maybe in 7 days or 2 weeks and say, you know, how are you doing? How did you do? And continue with another habit. So I think we have to simplify a lot of the lifestyle medicine we do right now to make it a lot more effective and to reach more people with sustainable health. So please implement prescribed lifestyle medicine. As you can see here, these are some of the basic tools and points that you can help the clients with. Now, our approach, as I said, is a lot more specific. We add that. So it's still evidence-based lifestyle medicine, but we believe, and all our practitioners, faculty believes, that we need to upgrade. We need to really move forward. Every industry, every science is just starting, right? It's not the end, it's the beginning. And we are very much at the beginning in lifestyle medicine. I can promise you in 5 years, we're going to have so many more incredibly effective tools than we have now, where the research backing that up. Now, let me explain these two images here, and that's all of our practitioners use, and they love it. And there's a reason why. So first of all, let me ask you something. If a client comes to you, or if you have, for example, a skin issue, eczema, itchy skin somewhere in the body, maybe on the face, right? Or you have a right shoulder pain, or you have indigestion. If with regular lifestyle medicine, we change the diet, we help the body to exercise, we maybe use mindfulness or meditation or yoga, right, to strengthen that part of the body, and maybe add more of a social support. So it's this 6-pillar type of lifestyle improvement. But it's typically not organ tissue specific, right? So, if I have a very specific symptom, then typically we don't have a model that actually helps us to understand what's going on here. And so how we work, and again, with thousands and thousands of practitioners and even many more clients over like 10, 15 years, we noticed or found that every organ tissue in our body has very specific stress situations, stress triggers, typically life stressors, psychosocial stressors, and specific emotions and specific thought processes that are happening affecting that organ tissue. Plus the social aspect influencing, and lifestyle medicine, lifestyle habits influencing that habit or that organ symptom, right? So it's not random. I think I don't have enough time to go into detail. I will do this in my other talk about organ mind-brain anatomy, which is really, that's how we're calling this. How is that interaction? And so from right now, just let me ask you, I'd like to ask you, and type in the chat box, would you agree that lifestyle habits are also directly linked with specific stress situations, with specific emotions that we experience, and specific thoughts? And I'm talking about habitual biological processes, right? If for example, let me ask you too, Do you notice when you feel very stressed about something in your life, suddenly you have these thoughts pop up into your head all the time, and it's almost like you can't let it go, right? And emotions pop up. So I have a conversation with, let's say, my boss, and he puts me down. I might think about, oh my God, what did I do wrong again? I'm just not good at doing this. What did I do wrong? And then a lot of sadness comes in, or anger, right? Whatever it is. And obviously we can measure that, right? Which is this here. In terms of our root cause approach, based on organ and brain anatomy, or the lifestyle description approach, is that we, by asking a few questions, we realize, well, which specific emotion, thought, or stressful situation in our life, and which lifestyle habit affects that specific skin epidermis, itchy skin, that specific bronchial mucosa that is inflamed, that specific right knee, right, that is weak, or that specific small intestine versus the colon, right? This has to do with biology, meaning that every part of our body, if we believe it's random, our body just makes mistakes, there's errors, it's broken, blah, 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 it doesn't make any sense, right? I think most of us would agree. So what's that intelligence? What's going on when we have symptoms? Well, it's not random. It means the body's actually showing symptoms because we're out of balance. Specific organ tissue is out of balance with specific stresses, emotions, thoughts, lifestyle habits being connected with that organ tissue. The other thing is we have our points and phases, which is so important for chronic health issues. Because remember, right? Suddenly you get a symptom and then, oh my God, what happened? Well, something triggered that. And then you might be totally stressed and totally stress hormones high, symptoms are strong, and then somehow you feel different, right? Different symptoms might appear. It's this cycle, we're calling it the 5 or 9 points and phases of the self-healing process of chronic health issues. And knowing that, it's almost like it gives us a timeline, right? And in terms of this diagram, since we integrate this for like 3-4 years now, and it's amazing because basically, big picture here, we always measure every aspect of our client's state or root causes. And what we want is move our clients from the unwanted, old, unhealthy habit, which is over here, the minus part, right? Move them towards the plus side. So in pain, for example, you ask client, how strong is the pain right now? Oh, it's a -8. It's pretty strong. Okay, and then we use tools and techniques to lower that. Stress management tools and therapeutic or coaching tools, so to speak, not therapeutic, but coaching tools, and towards 0 where the pain starts to dissipate. But then we need to move into the plus side. What's the new habit, right? It's the glass of water, dirty water, so to speak. Old water is filling up the cup. Then we let it go, fill it out or take it out. And what do we fill it up with? Clean water. So what's that new habit? And we want to move it towards +10, which means once a client has a new habit and feeds it as a +10, that's installed. They use it, they do it, and it's not going to be gone. It's not going to go away, right? So it's very specific, simplified, specific tools to use lifestyle medicine with a stronger focus on stress management. Last question, and then we have to go. Would you say that if you have, and that's please everybody post in the chat box, would you agree or not? That's what I'd like to find out. If, let's say, you are totally stressed, you have a traumatic experience, you lost money, or you have a fight with your job or relationship or whatever it is, and it just really like it bugs you, right? You have high emotions, thoughts, and it's just there all the time. Would you agree it is much more difficult to actually make lifestyle improvements like having a new diet, improving your diet, exercising, meditating, and so on, versus first you become less stressed, you manage your emotions, your thoughts, psychological, psychosocial stress and life stresses more, reduce them, and then it's automatically easier to, let's say, oh, now I'm ready to actually improve my diet. My point being here, do you feel psychosocial stress, life stresses is an important, very important aspect to help ourselves and our clients to improve radically versus focusing just on diet, which is wonderful and important, but give me some feedback in the chat box, okay? So I want to wrap up here and again try to give you like an understanding or like our view of what it is in terms of the options our clients, our patients have. Show what prescribing lifestyle medicine is and why we need it. So important. Great tools to use, and our lifestyle prescription kind of organ, mind, brain anatomy, where we become more specific. And the more specific we are, we know this in medicine, the more clear we are, the more specific we are, the easier it is for us to have an analysis, kind of a holistic diagnosis, what's going on with the client, and then use the tools that are appropriate for that client. So it's highly personalized, organ tissue specific, and also micro habit improvements to see improved health outcomes to prevent, reduce, and reverse chronic symptoms. So thank you guys again so much for being here. I have another talk, I think, tomorrow or so that goes more into this because I find it so fulfilling to know when, let's say, a physician, any healthcare provider, a spiritual healer, a health coach, they know the connection between psychosocial, organ, mind, brain, mind, bodies, psychosocial, there's many different names for that. And we have the same understanding of what's going on, because then it makes working together in a group, also in a healthcare group, a lot easier. So very important to touch upon every component of health and wellness. Absolutely. Harder to make changes while stressed. Absolutely. Yes. Good. So thank you, everybody. Really continue chatting or typing chats into the chat box, your comments. We're going to be back in about 2 minutes with Dr. Yamani, and you don't want to miss it. Thank you. Hello, welcome back. Hello. I'm so excited to have Dr. Yamani here, which I guess I'm going to introduce him in a minute. So first of all, welcome, Dr. Yamani. How are you?
Good. Glad to be here. How are you?
Good, good, good. Oh, it's good to see you. Now, let
I
me
was
introduce
listening
you
to,
quickly before we get started. And so, I would say you are one of the top leading lifestyle medicine researchers and practitioners in US, I would say for sure, but worldwide, but very likely because you are also in different countries, Pakistan and others, where you teach. And basically, have very busy, I think, 3 clinics in Florida. Are an Dr. Ornish provider, did with us with Lifestyle Conception University. You're the chief medical officer, and you did the last year's Healthy Wealthy research project, which I hope you talk about, which is astounding, right? How that worked out. And so, yeah, thank you so much for being here.
thank you. Thanks for giving me the opportunity to come and talk. Is really exciting. Yeah, happy to share my little bit of experience in the journey. But it's a journey, right? It's an ongoing journey, and a lot more need to be done. I think we're just scratching the surface of this revolution, or I would say much needed change that our patients, all of us, our population needs. So yeah, thanks for inviting me for this opportunity.
And thank you. And I mean, basically, I'd like to actually have both options. We have like a nice set of time
Yeah.
where we can talk about the patient side. What's the experience of patients that work with you, for example, in your clinic, the health outcomes, and then also for healthcare providers, for physicians that say, how is this Dr. Yamani doing this? Right? And so we want to really dive into that. So, guys, everybody on online chat, let us know what the questions you have, both, right? Now, I want to say something quickly. I don't know if it's okay to talk about it. You know, you've been in Florida with a whole hurricane situation. So I mean, I really appreciate it because it was tough, right? And so I was sure you wouldn't be here. So yeah, I don't know if you want to talk about it, but I just want to tell everybody, not an easy situation there. And
Yeah, last week, easily was perhaps the toughest experience in my life. Actually, I mean, it's amazing that even like living in Florida for 30 years now, we have hurricanes that impact other areas of Florida, and you feel for them and you see the devastation. But boy, when it happens to you, I mean, this time it went through us, Tampa area, and it's very humbling. It's the power of nature, and your life can change in few hours, right? I mean, and that's something perhaps very much related to all of our stresses that we think are stress. In last 1 week, the idea of stress is completely changed, right? So I'm not going to be worried about the traffic light anymore. you know I'm not going to be get angry about my cell phone. I missed my cell phone, or it fell in the water or something like that. I mean, small little things that we actually have trained ourselves to get worried about, right? And then it add to the stress, and because it could be worse in no time, right? I mean, so yeah, it's an humbling experience, and thank God, that we feared a lot of damages. I mean, we survived. We kind of, we were the victim of the later onset flooding. This phenomena, I never recognized that it existed. That after, in 2-3 hours, it poured in 18 inches of rain, and we didn't have any wind damage or stuff like that, but our cabin is next to a lake. And then, next morning when we woke up, we were surrounded by water. We flash flooding. The lake overloaded. They closed the gates of the lake because they didn't want rivers to crest and all that. So the water started to backlogging and all that. And
mm,
then escape, push our cars through, like 4 feet of water, stuff like that. Lost material possessions, but the thing is, we all are survived. And then, we feared more damages to the house from ongoing flooding, but it didn't happen. But it's amazing that this last 7 days, so much to learn and so much to change perspective, right? I mean,
mm,
what we think are is important, and like so essential. It's actually not. It's not. So,
Yeah,
like
what a big lesson.
big lesson. And what I, being, practicing lifestyle medicine and all that, I think your health is indeed everything, right? If you are healthy, material possessions can come, you can make money again, you can have the job again and all that. But if we don't take care of our health, we are like, and that's what we are, our challenge in lifestyle medicine to a regular patient. I do, we do insurance business, we see regular patients, we see those Medicare patients who are brainwashed just to wait for a procedure or a pill. Actually, we miss out on a lot of healthy basic lifestyle principles, because that health is everything. I mean, so yeah, I mean, I can talk for hours on this experience, but I think let's talk, something different.
Yeah. I think it's very relevant. I think
Yeah, it's great.
it exactly what you said, this importance of health, and as we know, I mean, if somebody has a high priority in terms of values and importance in life, and health is important, then they follow through and they do what we know, and they know, we all know what to do, right? But we just necessarily do it because other things become more important. So let's talk about patient side. Like, how do you do that? What do you do specifically in your practice? How do you what's the outcome also? And if you want to talk about the study, right, just I leave it open to you how you want to drive it, but let's focus on the patient side, someone that comes to you with chronic health issues, and what's the flow, and how is the outcome that you get with clients.
Yeah. So yeah, I'll talk about like what are the expectations of patients, or what kind of patients do we see? I mean, that I think on, and maybe that as a physician we do, as a provider we do see that kind of population, or maybe if we are one of those patients. So the biggest challenge that I see in our patients who are under the insurance coverage, either Medicare or someone else is paying for their health care, or they paid whatever the premiums and all that kind of thing. But what the mindset somehow for most of our patients is like that they, they think that I'm going to go to a doctor, and doctor is going to give me a prescription, and that prescription will solve all my problems. And that is an overwhelming belief that patients have. It's that, and again, it's funny that even though medicine is a science and we have all the scientific studies and we have evidence and we have double-blinded studies, but at the end of the day, for an individual, it is a belief system. you know so they so there are patients, like COVID clearly demarcated that whether you believe in vaccine or you don't, I mean, it become a belief. No, and very few people would go into the research and understand that if it is good for them, for example, right? So I think majority of the patient who come to us, they come to us with the belief, just give me a pill and I'll be okay. Or give me a surgery recommendation, then I'll be okay. So I give you an example, like for example, like uh, somebody is having inguinal pain or chest pain, and they have risk factors for coronary artery disease, and we do our workup, a stress test or an echo or cardiac catheterization, and then we tell patient, okay, Mr. Jones, you have blockages in your arteries, and you need to go and see a cardiologist, and they will either do an angioplasty or they'll do an open heart, right? So Mr. Jones is going to go to this cardiologist or surgery, and the procedure will be done. And then more than likely, the specialist will come out after the procedure, and very rightly so, proudly will tell the patient the surgery was successful. You came with 95% tight LED lesion, and I open it up and the lesion is 0%, and you're all set, everything is fine, right? And this patient come home, and the very next day is going to start eating their bagel and cheese and steaks, and watch Netflix because, survive and all that, stay there at home and all that. So unfortunately, we don't tell this patient that, listen, your artery was blocked, we open it up, but the mechanism, the underlying physiological mechanism that caused that blockage is still in your body. Whatever caused it is still in you. So now God has given you a chance, because now the artery is open. There's no imminent threat that you're going to die from that. But let's change the physiology. Let's change your nutrition. Let's change your idea of activity. Let's de-stress yourself. Let's have better relationships so that you have, love and support and mental calmness that you need in a household, right? Because those things are the reason that cause, that cause the blockages in the first place. So that mindset is not there with the patient. So for most of the patients who come to us, they are just looking for that quick fix, so to say, and they don't even think. I mean, I don't blame them, because it's a many decades of kind of organizational effort where we have created this market. I call them as a market creation. So the market is perfect for the way we practice, and there is no demand to change that, because people think that's how it is. So, and when it comes to a provider, we go through our medical school for first pre-med 4 years, then medical school for 4 years, then 3 years of residency, then 2 years of subspecialty, then another 2 years of further down specialty. So after like good 20 years of I would say conformation, a physician know how to follow the protocol, and when they recommend something, they're deeply honest in their recommendation, and they want well-being for the patient. But the tool that they have is only dependent on the training for 20 years that they have received. So with all honesty, they recommend a pill or a procedure, and they want wellness for the patient. However, so when these kind of patients come to a provider is going to direct them, guide them towards a specific medications or a procedure. They do not have a time to sit down with patient and talk about lifestyle, for two reasons. Number one, there is no reimbursement for that. So why would a business, which at the end of the day, every medical practice is a business. So at the end of the day, medical practice is not making any money. So why would they spend time on sitting down with patients and talk about lifestyle changes and changing, all the risk factors? But there is reimbursement for a procedure. So obviously I would do more procedure to make more. It's a simple math actually. So as a provider, and then there are studies, in my research, when I saw that there are studies done that if a primary care provider who sees 18 visits a day, if that provider has to educate patients about lifestyle medicine, that provider need 10 plus 10 and a half hours more in a day to educate those patients. So that thing is not happening right now. And there's no model that can promote this kind of thing. So for as a provider, if you're a provider, obviously you're gonna do what the protocol says, and you're gonna have to see certain numbers or certain ideas and stuff like that, and that's how you kind of roll. So it is all conform ideas between physicians and between providers and between patients also, that we just go through kind of a protocol medicine, and no one actually has a time to sit back and take a deep breath and ask these questions as what is happening. Are we really changing patients' lives for any meaningful way? We still have 80% of our burden of diseases are from chronic disease, and all of the chronic diseases, including diabetes, type 2 obesity, hypertension, coronary artery disease, dementia, depression, cancers, metabolic disorders, are all lifestyle based. These are all epigenetics. I mean, yes, there are genetics working on it and all that, but even with genetic prepositions to these chronic diseases, we can alter the course through epigenetics, through lifestyle and all that. So, in a nutshell, I think that's the predicament and issue that we have for now in our current providers and patients.
Can I ask you something specifically? Because we did ask all our speakers, or the majority of our speakers, to give us feedback. Like, I read the question. What do you feel are the most important policy or healthcare changes needed to change healthcare the way I think most of us, or all of us really that are in this field, want? And the three, there were like 5, 10 important ones, but the top ones are physicians and healthcare providers to be trained and educated in lifestyle medicine, right? Number 2 was reimbursing lifestyle medicine and health coaching services. And 3, restrict medical advertising, especially big pharma and all that, right? By manufacturers and so on. What would you say? And it was interesting. It was kind of very unique that most said these 3 are probably the top ones. What would you say? If I nail it down to one, what would you say that helps patients to really have the availability, the option to be treated with lifestyle medicine?
Yeah, I mean, that's kind of a tough one, I would say, to answer. But I mean, answer is very simple. It's one word. It's called money.
I agree. I think everything is simple if you break it down to what really is the blockage, right? If you address the root cause, I totally agree. That's really what it is.
It's called money. I mean, look, I have 2 boys. They're both in medical schools, and I hear them talk, and their colleagues come visit us, right? And they're American born and all that, and they are exposed to good education, and I would say they're exposed to very ethical ideas of the society. But guess what they want to become? A dermatologist, an orthopedic surgeon, pain management. And very sadly, they want to do that because they want lavish lifestyle, because reimbursement for these specialties are the highest. They're not thinking that what their mission is. They're not thinking that what's going to happen to the patient's population and all that. Oh, by the way, yeah, it's like a by the way discussion. Oh yeah, that too, right? So I mean, that's the reality. We are producing these doctors based on incentive. I mean, unfortunately, or maybe, and the reality, Johannes, our beliefs are based on our incentives. There are no 2 things about it. I believe what is my incentive, either good or bad, right? So I go away from pain and I go towards pleasure, incentive, right? So why would a multi-trillion-dollar whatever, I think healthcare industry is $4.2 trillion industry in America. If health industry were a country, we were the 4th largest economy of the world. So with that kind of 800-pound gorilla, or maybe 8,000-pound gorilla in the room, why would we change that? Why anybody would change that? I say, again, my simple logic is that okay, we are encouraging. We have a system through which everything go through the protocol, and if I'm a CEO of a corporation, I'm worried about my quarterly benefit. I have my investors, that I have to satisfy. So I would do everything for my, how the market is behaving and all that kind of thing. So the game is played between the top players, in between, sometime here, sometime there. right? Some, one camp would win for few years based on the government, and the other camp would win for the next session and stuff like that. So it's a, you know, um, if what if maybe in some idealistic way, again, somebody who is Yale and Harvard graduates, and they want to make billions, by all means do it. I mean, nothing wrong in doing that. But how about we shift the whole pendulum from appreciating and reimbursing the procedure to those who are trying to delay the onset of chronic diseases and managing chronic diseases through lifestyle. So let's say in an ideal world, if we created a specialty called lifestyle medicine, and somehow we change the Medicare codes where a lifestyle medicine specialist who would spend 1 hour with a group of, let's say, 10 patients would get reimbursement more than a doctor who do a hip replacement, or a hospital that they make $500,000 for one hip replacement, for example. I don't know the amount, but let's say if they're doing that. So if that life-changing or lifestyle medicine specialty would make something similar amount of money, I bet you, Johannes, because deep inside every physician know what's right and what's wrong, and they want to do the right thing. They come to medicine with good intention. It's just the environment. So if we do that, we will have more doctors who would choose lifestyle medicine over other procedures and all that kind of thing. And
Yeah.
and again, market is key in an open society. You need market, but market is created. Like, who said that? I think Ford said that if I would have asked them that, what do you want for the better ride in those days, or 50s, 60s, they would have told him a faster horse, right? So the market, I mean, he brought his car idea. Before cell phone, nobody knew what the cell phone is. So markets are created within 15 years. These
Mm.
are expert people. So we can create market if we want to, and then the market forces will kind of supplement the whole idea of reimbursement and all that. So until and unless we do that, I don't think so things are happening.
Yeah, no, and that's a really good point. So all about reimbursement. I mean, sorry, it's all about incentives, and changing the incentive structure. I totally agree. So, but let's go back to the lifestyle medicine aspect, because I know a lot of the listeners, like, um, how do I say, how can we not just the implementation part, but actually once we work with lifestyle medicine, how does that flow? What are the important aspects? And I want to dive into a few of them. We both with Brad also. Brad, we were at a medical conference having CE credits points that we taught there. Physicians, and we were always so surprised how open the physicians actually were. They said, finally something new, right, that actually makes sense, and it's like a positive aspect of implementing a type of medicine. Is not just trying to fix someone. And so then you had a talk and you asked a question that everybody like, what? The discussion was amazing, because you hit a point that the question not necessarily reflects, but once you dive into it, it is actually profound. So can you share that, what the question was, and then what you meant by the question, and how it's relevant for everybody here that's watching, physicians and not physicians, and all of us, right?
Yeah, all comers. Yeah. So yeah, I think what you are mentioning, it's those are the CME. Our audience was all physicians. So that conference where we were in Chicago, and then in that, I kind of came up with just the question. So I wanted to engage the audience, and so remember, these are all physicians there, and most of them were like successful physicians. They were not like intern or college students like that. They were like established physicians who have practices for a few years or many years and very successful and understand the nature of the business and understand their patients and all that. And then all of it, I think we were having this idea of what are the lifestyle changes and all that. And I asked them, how long do they want to live? So, most of them have good religious, cultural background, and they said, as long as God wants us to live. Someone says that, oh, once I get my last one married and out of the house, then that's it, I'm done, stuff like that. So I said, no, I want to know how long. Give me a number. So if someone is 50 years old, I wanted to know what's the number, how long you want to live. Like, so back and forth, I think it took us like almost like uh, 10, 12 minutes to sink in the question. That in a way, the implied question was, what if you are given a chance that God ask you, okay, give me the number, and then I'll grant you that long of life, type of thing. So then they said, okay, if it is only for the number, somebody says 85, somebody says 90, somebody says 100, some enthusiastic says forever, type of thing, or maybe 120, more of the longevity type of people. But idea was not that how long we live. Idea of the question was, let's say if we call a number, let's say 85, for example. So if I'm a 50-year-old man today, 35 more years, right? So 35 more years. So what in lifestyle medicine, what we actually, that practice, I call it lifetime assessment and risk assessment. These are the two things that we these are little, just like your scale system is there. So we have these scale system where we tell them, okay, if it is 35 more years, so let's say if you decide about your objectives, how do you want to be when you're 85? See, right now, unfortunately, most of our patients, they think it's not in our control. So if you see in the United States, last 10 years of a typical patient is between nursing homes, hospital emergency rooms, hospital operation room, pharmacy. If we really calculate the number of time they go to pharmacy just to pick up their prescription and kind of divide them into how many days and all that kind of thing, I mean, maybe 1/10 of their life is spending, I'm talking about last 10 years. And then, so in between hospital, and there's no quality of life. So yeah, statistically, our population is living longer, but what is the quality of life? And some of the researchers call it lifespan versus health span, and I think it's a very good definition. So the idea is, are we increasing the health span, and what is their understanding of health span? So individually, I ask them, and I show them one of my typical patients, especially last 2 years. I mean, they're like that kind of life no one wish for anyone. Until now, patient has this, somehow they believe that they have no control of such outcome, which is so wrong, actually, because like if you're 40 years old or 30, I mean, the sooner you start, the better, right? Map out your lifetime, understand your risk factors. So if it is cardiovascular disease that's going to kill you, so these suffering come from these four major chronic conditions. Number one is cardiovascular, number two cancer, number three your neurodegenerative, which is depression and dementia, and number four is your metabolic, obesity and diabetes and all related diseases with that. So these are the do we really know our risk factors? What's going to kill me? It was going to be the heart disease, or I'm going to suffering from dementia and all that. And guess what? We can plan it to prevent that, right? So the thing is, if I'm planning 35 more years, so number one is risk factor stratification. Number two, objective, right? We have objectives for everything. You know, if we want to travel, for example, overseas, or even, you know, for 2 hours drive, we have a Google map. You know, we want to make sure that gas is good in our car. We want to make sure tires are good. You know, we want to know where we're going to stay in that, you know, if I'm going to Orlando or somewhere like that. We plan everything, but for our life, for our own health, I don't see that patients have any objectives. So we ask them, so I ask them to make objectives, you know, give me like top 5 objectives. So somebody says, okay, they want to travel the world even if they're 85-year-old. I said, okay, that's a good idea. So let's you know, deconstruct that. If you want to travel at age of 85, you obviously have the need to have a capacity to understand the directions, understand the traveling plan. So you need your cognition, right? So what do you need to do to have your good cognition? So understanding what is your cognition and your brain powers now, right? And what are the nutritional and other exercises and tools that we have to improve that cognition when you're 95, knowing that cognition will decline. You know, just a simple fact of aging. It doesn't matter, you know, who you are and what you do. We all going to have the aging that's going to impact us. But the thing is, it can be assessed what you are now and what you going to be at 85. So let's say whatever your objectives are, based on those objectives, you strategize, you make a strategy. And a strategy is not the same as tactics. More tactical detail is what I'm going to eat in breakfast. That's tactical detail. What kind of exercise is good? Should I lift heavy weights or I do more cardio? These are tactical detail. Tactical details to me is only 10% of the equation. 90% is your objective determination. What top 5 or 10 things you want to do when you're 85, and then deconstruct it, reverse engineer it to today, and you will find out what you need to do today to start working towards that. And you know, guess what? Your today is going to be, you know, pleasant and blissful because you have a goal of your health and objective and all that. The strategical detail, we can all differ, we can argue against, in favor and all that. It really doesn't matter. You can be in any camp as long as you know your objective and you know your strategies, and then decide your tactical detail. So I think that was our discussion. And then, you know, and I went to basically DC also and talked to those doctors. They really like it. So I guess it looks like something that may work for all of us.
Yeah, I mean, it's such a simple question, but once you dive into it, it's going into our beliefs, limiting beliefs, right? The program that we have, which still vast majority, I think, even in terms of physicians, healthcare providers, they still believe that our genetics determine our health or longevity, right? Is it true?
Absolutely. I mean, and I think that belief comes from, Johannes, from the idea that we don't want to work hard. It's a human nature. Getting by, right? The survival, our instincts of see, that's the difference. I see it from the difference from creativity to just from surviving. So when it comes to our health, we are only all about surviving. We don't want to create anything. And that's a human folly in general, human folly. So just tell me to get by, you know. And that's why, you know, we just do that. You know, we like things that just to get by, you know.
Yeah, absolutely. So can you share can you share also more specifically how you work with your patients, and maybe also about the research, what was surprising to you, and you know, in terms of what the outcomes was, and how that affected you also in terms of how you work with patients in your practice?
So I think I am one of the few fortunate physicians who have a contractual setup, an agreement with Medicare under a Medicare Advantage plan. Now, there are a lot of providers especially in Florida, who does that contract business with Medicare. And like for those who doesn't are not familiar with what Medicare is, it's basically a government sponsor program that everybody after age 65 is entitled for medical coverage. So that medical coverage is based on an idea that each patient, uh, uh, the recipient of Medicare, has a finite amount of dollar assigned per member per month, PMPM. That's how we call it. So per member per month amount is there, and then the Medicare assigned that number based on a benchmark for historical expenses and stuff like that, and the funding. So we kind of know those numbers, that how much is there assigned and all that, and then Medicare outsource that to health plans, different health plans, and health plans take whatever their percentage for their expenses and profits, and then they extend this risk to providers like us. So we take what we call it financial risk in that. But why it was fortunate that I was able to offer lifestyle medicine to our patients within whatever the funding available to us, right? And again, physicians have a choice how they want to utilize, how they want to practice medicine. And normally, I mean, there's no requirement from the government to have a particular way, as long as you are within the confine of standards of practice of medicine and all that. But very early in the days, I realized that we are not doing much for the patient itself. We are trying to mitigate the risk by clicking buttons on a computer, right? So, and then we met Johannes at that time, and we created this program. So what we started to do at that time, we offer patients wellness and lifestyle medicine services. And one of the initiative of that was we did a study where we hire coaches from Lifestyle Medicine University. Johannes was instrumental in that. And then we have our own staff train, and then we kind of recruit patients. During that time, I was working with Harvard Medical College, so they help us also in structure that study. So what we did is we have a kind of a control arm, and then we have the intervention arm. So we have patients assigned to intervention arm, and what it means that those patients who agree to follow the protocol of lifestyle medicine, that's mean what they are eating needs to be monitored, how much they are moving, exercise, what kind of stress management measure they have, and what kind of emotional support or sort of social determinant of health support they have. So these are the 4 or 5 criteria, and I kind of designed those 10 markers. Biomarkers were included, such as CRP, hemoglobin A1C, waist to hip ratio, BMI, type thing. So we have assigned those markers. And then the other arm was a control arm where we offered them for the program, and they said no, they don't want to, but they agreed to have their biomarkers measured, right? So we have these two groups, and we followed them for 1 year, and I think partly like up to a little bit more than 4 months, we did the intervention where the coaches were assigned to them, and these coaches will talk to them on the phone, on Zoom. They do group classes. We kind of did not specify how they're going to get contact with those patients, but we just let the coaches and the patient decide how they want to. But they must meet, first of all, the coach was available to those patients 24/7, obviously on the phone or text. But then they have weekly classes, and also they have at least twice a month group classes and all that. So some protocol was there, but it's sort of based on lifestyle medicine principles, right? and they were taking their medication just like same. We didn't change anything, in their medications and all. Yeah, a couple of criteria were how much, number of ER visits, how many times they would go to the emergency room, or a number of hospitalizations. So, it was a short study in a way, and it was part of the capstone project with Harvard Medical School. So we had to conclude the study and all. And then at the end of the study, the most surprising part, the level of depression went down. The PHQ-9, one of the criteria, and in control it was like 6.7 or 7 score of PHQ-9, and those interventions arm was only like 2.3. I mean, significant uh, reduction in depression scale. And the number of ER visits, 67% less ER visit um, in those interventions. They didn't go to the emergency room. So that kind of confirmed that our known fact that 50% of ER visits in US are based on anxiety. It's not a real, medical problem. But the tragedy is that 50% of ER visits are converted into hospitalizations, because if you're going to go to the emergency room, they'll find something to admit you, because that's how the system works. So there was 67% reduction in hospitalization, and just because of the fact that there was reduced hospitalization, we saved $425 per member per month. And idea was that I wanted to monetize the value of lifestyle medicine, and we showed it, right? However, whenever we brought that study to any of the CEOs, they poke hole in the study, and they didn't like what we showed. And so right now, what we have, this one of the hospital would do a study on a larger scale, and that's where we are at right now.
Yeah, I mean, and I think what was really special for me was listening to the participants. Again, I think we're Medicare patients 65 to 85 or so in age range, and it's like the stories they talked about, told, and how much they really meant to them, the quality of life. I mean, how do you measure that, right? And it was just completely changed. One person said they're thinking about just ending their lives, and now they are full of energy, want to continue, and say, I want to experience as much as possible. This one lady stuck with me, said, I'm in a wheelchair and I'm never going to walk to my post office again. It was 2 blocks away, right? Which they did after 4 weeks. I mean, these things are mind blowing, right? And so but I think also, as we know, there's some research, and quite a lot of research out there, that shows these um, also from a monetary perspective, right? And I think that is something that obviously is really important, because otherwise, as we said, money talks these days, right? So we have a few more minutes. What is it you want to share in terms of some inspirational message, maybe something that you feel for anybody that is listening, has chronic health issues, and says, I don't know, I mean, I can't find anybody, what do I do, how to get started, and so on?
Yeah, I think, finding a good primary care doctor, it starts with that. So, there are a lot of factors that how the patient choose their primary care doctor in our culture, in our medical culture, I would say, is based on the agent that they know, the insurance agent. And, again, they're all good. I mean, just like if you have a financial agent who's working for you, they will not harm you, but their priority is them, not you. So, agent, don't rely 100% on agent. Investigate your primary care doctor. Find out availability, affability, ability. I mean, all these fundamentals are given. You need to have that. But then, do they go for CMEs? What kind of studies, research they are doing, right? Or what is their interest? And you will find primary care physicians who have interest in lifestyle medicine. So maybe choose that, number one. That's the starting point. Number two, have your objectives very clear, right? What, again, that question, how long you want to live, ask yourself how long you want to live. Right? I mean, I think from this conference, if nothing else, if you take that, that's a big plus, that, okay, how long you want to live, and then become responsible, right? I mean, that's the thing. And when physicians say it's all genetics, because they don't want to work hard, oh, I can't do anything. I mean, it's easy escape. So it's your health, your physicians or your consultants are as good as you are, so um so one thing is that make like maybe top 5 objectives, and then what are the strategies you're going to use. So you may, again, molecules, which is your medications and your supplements, are part of the game, right? But maybe number 5, the first 4 are nutrition, your daily routine of exercise, your de-stressing methods, meditations, and your group support, love and support in your life. And then maybe number 5. So nobody's rejecting. I mean, that's how I make my living, by giving prescription medicines every day in and day out. So, there's nothing against it. We're not demonizing it or anything like that. But understand where it comes in the picture. Just don't look for a pill when you have a pain. Try, just like you were saying, find out there are other biological reasoning for this pain. Pain is a signal of something wrong. Stress, is a signal of something wrong. And then, we are not only biological being, we are energy too, and we are wave too also, that frequencies are different. So, open your mind and think about what other possibilities are. So make strategy based on that, and use all kind of strategies as much as you can do, and then find the tactical detail. But don't hunker in too much into the strategy. Don't fight about the milligram, how much gram of protein one must take, and then don't spend hours and hours researching that on that. I mean, those are, see why the tactical details are so famous, Johannes, because of money again. People who are selling supplements and selling, like a lotion or potion, to saying that this is the, like a what fountain of youth is found and blah blah. I mean, no one has, there's no one factor is going to make, make you do your objectives and all that. So I say tactical detail is the minor part, but the thing is, decide on your strategy and objective first, and then, make a, and then again, yeah, stratify your risk factors. So if if you may have, no, somebody told you your mom had a heart attack or your dad has a heart attack. What was it? Because heart attack is a very generic term for that. Was it blockage in the coronaries? Was it a valvular heart disease? What is it? Atrial fibrillation or some conduction block or something? Go into the detail what really happened and what age was it, right? So, you can stratify your own risk factors. What kind of cancer, if there's any genetic markers done on those cancers, stuff like that. So go into the timeline, little bit more detail. So those are the 2 things I would say,
Thank you again so much, Yamani. Really, really appreciate it. It's always wonderful talking to you, coming from that deep practical experience in terms of lifestyle medicine, having a practice for so long. So thank you. Have another talk, I think, on the Physicians Day, which is more the nitty-gritty part that physicians want to know. I mean, how do you do that? So if somebody's interested. Thanks also for being here after this kind of very stressful last week, with the hurricane. So really appreciate it. Thank you. Thank you so much.
Appreciate it. Thanks very much.
See you soon, huh? Thank you. Thank you. So everybody, we're going to be back in a let's say 1 minute with a great topic. See you back in a minute. Hello and welcome back. Our next presenter speaker is Stephan Herzog. Hi, Stephan. How are you?
I'm doing well. How are you, Johannes? Can you hear me?
Very good. Having a blast here.
Good.
Really good. Let me introduce you for everyone. So you're Executive Director of the American or International Board of Lifestyle Medicine. You've been very instrumental in this field for many, many years, decades, right? As I think also with the CHIP program, revamping it, making it more available, worked with the lifestyle medicine solution clinics, and you were, I think, Executive Director of the American Board of Lifestyle Medicine. So I hope I got this right. But the thing is, I think internationally, everybody that is in lifestyle medicine knows you because you are the driving force internationally to bring lifestyle medicine into the world. So great to be here, great to see you. And I think you're going to talk about, the certification part, why it's important, US versus international, and so on. And we have hopefully a little bit of discussion at the end.
No worries. So I share my screen. I press the button, right?
Yes, yes.
Okay. Choose what you want to share. Okay. Can you see that?
Should be coming in a second. Did you click share? Not yet. You have to, I think, click share or something. Either full screen or.
Hang on. I did click share. Select tab to share.
Oh yeah, so that like the screen, whatever you want to share, the PowerPoint, I guess.
Yeah, but hang on. How do I get this up on the share? It doesn't show me. The site will be able to see content of your screen, but it actually doesn't.
Maybe.
Sorry about that.
No worries. So basically,
I just see an empty screen here. Choose what to share with Studio Stream.
If it's okay, just click like the entire screen. You can share the whole monitor screen basically if it's okay.
Yeah, but nothing happens. Oh, let me do cancel again and try again.
Yeah, that's probably good. And meanwhile, type in, everybody watching, type in the chat box, what you're interested in specifically in terms of certification, if you're a healthcare professional, and Stephan can answer that in a minute.
Okay, can you see this?
Let's see, Alessandro in the back end here. Not yet. That is interesting. Did you send us, or can you send us quickly the slides, and then we can Sandro can do it from the back end and can just display it. Meanwhile, we talk.
Yep, I'm just, again, this is I don't understand. I got the entire screen so I can see myself in the little bit, but then when I click my PowerPoint,
you have to select either a window tab or, and then in the tab, select the PowerPoint, and then there should be at the bottom share or something.
Okay, now I could see it. Can you see it?
Nothing yet. Entire screen.
When I go back and forth, I can see it on my screen.
Yeah. Let's see. Maybe best just send it by email.
Right.
Yeah, and then
to you?
Yeah, send it to me for now, and then meanwhile we talk, and
okay.
No worries. So here we go. So everybody, let's sorry for that. We're gonna be back in a second here and get ready.
Is it Johannes 1 or just Johannes?
Johannes, yeah.
Okay. It's on its way.
Cool.
Sorry about that.
Let's talk about a little bit their work in lifestyle medicine specifically, and like, because you've been instrumental over the last, I don't know, decade or something, or many years in terms of lifestyle medicine. how did it grow and why? What was the incentive in terms of, we talked about incentive before, right? We don't get the right incentives, but how did you make it grow and help grow?
Well, the key was that when the American College, which probably was the most mature lifestyle medicine society around the world, decided that somehow they need to legitimize the field, because just talking about the science is obviously a start, but when you get right to it, particularly in sophisticated or in developed countries, there is a very strict kind of certification regimen. So you're an MD, but then you got to specialize. So you got to be a family medicine physician, internal medicine, and so on. And so the American College decided that you need to have board certification in lifestyle medicine to legitimize the field. And the moment we started in the US, we obviously had international physicians who have been living in this space for a while saying, well, what about us? We need the same legitimation. And so we decided that we create the International Board of Lifestyle Medicine. And we invited obviously people from all over the world to contribute to that. So it wouldn't be an American-centric affair, because again, you obviously can, when you look at the body physiology, it's the same the world over. I know each country thinks that they're special, and each country thinks, oh, but you don't understand, it works differently where we live. Well, fact of the matter is that blood is red in everybody, and more fiber makes you poop more often. And that's universal. How you get your fiber or what particular food you get your fiber from, that might vary. But the physiology, what fiber does in your body, doesn't actually change from race or nation or gender. It's the same the world over. And so rather than worrying about what differences we might have, we stick to this Pareto thing, 80-20. 80% of everything that we do is actually the same the world over. And yes, there might be variation of 20%, but that's okay. We live with that, and you can adjust that in your country. So when you look at the international certification, it's been put together by people from every continent, by lifestyle medicine professionals from all over the world, and the same with the educational underlying principles, because obviously in order to get tested, you need to study first the material that you get tested on. And so we took the lifestyle medicine evidence base, and people put that into what we call lifestyle medicine competencies. And then they got published in various journals, and the American Journal of Medicine published in 2010. They published the first time, these are the lifestyle medicine competencies, and then they got updated in 2021. And that's the basis upon which educational material is written, and the basis upon which then the certification exam is written. And so that's kind of standardized the world over. And that's the exciting part, is that there is no other medical discipline on earth that has got the same certification exam all over the world. And if you sit it in Timbuktu, it's the same as you sit it in New York City or anywhere else on earth. And that's, we're kind of quite proud of that, right?
You can be. Well done, really well done. I think the slides are ready, so I think let's bring them in, and then we talk more afterwards.
I'll talk fast.
Yeah, I know you do.
Okay, just move straight ahead. Can I change them?
I think yes. With the mouse, there should be a button there.
Okay.
Or an arrow.
Okay. Yes, I can see. Wonderful. Okay. Session objectives, let's skip. The key is that what we do in lifestyle medicine, it's all evidence-based, and this becomes very important in a few slides' time. We talked about the global standards, we talked about models that are financially viable, and we just want to be innovative so that we really can address the global epidemic of non-communicable disease. When we look at the whole lifestyle medicine framework, there is many people who do things for various reasons. The lifestyle medicine movement determined right off the bat that we want to be in the house of medicine, we want to be evidence-based, we want to be physician-led, and the core of what we do is human health. Now, we acknowledge that there is obviously upstream and downstream benefits. So people come from climate change, they come from animal rights, they come from veganism, they come from religion. There is many reasons why people join. But when we talk to each other, we're not going to go off on tangents, and we're not doing this to stop global warming. We're doing this to improve human health. And if the downstream benefit is less meat eating, therefore less tropical forest removal, therefore climate, I guess, maintenance, then that's a good thing. When you look at the outlines, just a quick slide on what people actually get tested on, and you will find that on the IBLM and ABLM websites, it just gives you an idea of what actually the lifestyle medicine competencies are all about. The numbers behind mean the percentage of questions that feature in the certification exam. When you go onto the website, you can then look at the stratification of those individual things. So under emotional and mental well-being, you can see there is a very stratified explanation of what this actually means. And so again, in the interest of time, I let you go and look at that yourself on the screen on the website. I want to talk quickly about the landscape. We talked about evidence-based. So when we started this movement, we were all one happy family, and we were all helping each other. And obviously the finance that the certification exams provided were distributed back into the countries so that these countries could then build their own capability, because we're a not-for-profit. And so until a year and a half ago, we're all an unhappy family. And then the Brits did what they usually do best, which is Brexit. And they decided they would like to be evidence-informed. So they include paleo and keto and whatever else. And we had a couple of countries following them. And so they have their own, what they call an accreditation, but it's not exam-based, and it's very National Health Service focused. And so just be aware that there is 2 people out there who offer lifestyle medicine. And we obviously encourage you to go with the evidence-based people. When you look at, I talked about who writes the exam, because again, that's really, really important, because obviously there is a narrative out there that this is very American, and nothing could be further from the truth. When you look at the Lifestyle Medicine Global Alliance is an assortment or an association of national lifestyle medicine societies. They have an advisory board. They are the custodians of the lifestyle medicine competencies that we saw a few slides back. And of that, we have educational program writers and we have question writers. And you can see on the right-hand side, there is quite a few countries. So Hungary and Argentina and Chile and Lithuania and Qatar. These are all countries who wrote their own educational exams in order to, educational programs in order to support then the exam. And so you can study these and then sit for the exam. So there is quite a plethora of opportunities out there. When you look at the arrest and reversal of chronic disease in the lifestyle medicine context, and I'm probably here preaching to the choir, but I just want you to understand that both the non-communicable disease model and the chronic disease model are exactly the same. It's just a diagnose and prescribe many, many times a day, which doesn't lead to any prevention, arrest, or reversal of disease. And it also just manages an illness rather than reversing a disease. Most importantly, though, it's terribly unsatisfactory for the people who do this. And so when we look at the background of this, when you look at prevention of chronic disease, what you do in order to not get the disease, the challenge is that we all do what we know what to do, but we don't do what we know. So we all we know smoking is bad for you, but we're going to smoke until somebody says, hey, you're developing throat cancer, lung cancer, whatnot. The challenge is that we do not change current behavior to address a future illness. We only do things that is immediately giving an effect. With the arrest, the challenge is that we all have some form of food addiction. We're all somewhere on the susceptibility scale of food addictions. Some of us are very high, some of us are very low. But as Michael Greger always said, there is no moderate heart attack. There is no such thing as moderate gangrene. So the whole idea of moderation doesn't actually work well at all. So it truly is a change of behavior. But when you look at the behavior change for reversal, we know there is a dose response to what you do. So, we obviously love when people promote meatless Mondays. But if you have unhealthy food, highly processed food, highly cholesterol containing, saturated fat containing foods for breakfast, lunch, and dinner, 6 days a week, and then 1 day a week you swap your steak against a highly processed bag of chips and some fat Coke. That doesn't quite do the trick either. And so again, what we need to work on is when you tell people, hey, how about you change the way you eat, the way you move, the way you sleep? People always think of deprivation. Oh, what is it that I can no longer do? And I think as lifestyle medicine professionals, we need to get people into a mindset of celebration. Hey, look at all the wonderful things that you can do and all the positive benefits it provides you. I can walk up the stairs without being out of breath. I just heard you say going from the wheelchair to walking to the mailbox. I can play with my grandkids. I can do things. And when I eat and when I sleep and when I move, I feel great. And I think that's what we need our message to be. When you look at the landscape, and we have all heard of obviously functional and integrative medicine, and where does this all fit in together? This is my favorite slide. When you look at on the left-hand side, from a low-cost and natural intervention to a high-risk, high-cost foreign invasive intervention on that sliding scale. And when you look at what you learn at med school, we talk about surgery and we talk about prescriptions, and that's what med school does really well. But we don't actually provide anything at the bottom. When you look at functional and integrative medicine, it's much more into the natural therapy. So, instead of eating the orange, you take a vitamin C gummy. In lifestyle medicine, we want to be the basis of all medical care. And so when you look at the framework, we don't actually want to be our own medical specialty. We would like to be the new foundation of every existing medical specialty around the world, because the way we eat, sleep, move, and think, that's actually core to anything and everything that we do. So our approach to this is that I disrespectfully call retrofit existing health professionals. So people who come out of nursing school, come out of med school, come out of whatever, and they have never heard of nutrition, or the only nutrition they had was, well, what's the difference between a carbohydrate and a protein? But the benefits of healthy nutrition were never part of it. The same with movement, the same with sleep or whatever else. And so we want to just educate those people and then certify them. But at the same time, we also want to update the production line. In other words, work with medical schools, with nursing schools, with anybody who trains medical professionals to update their curricula so that when they come out of the pipeline, they actually know the principles of lifestyle medicine, and we do not have to teach them afterwards. But again, that's probably a little bit of a utopia, and maybe in 20, 30 years' time, we might get there. We don't mind making ourselves redundant. A lot of people ask, why should I get certified? And obviously, we already talked a little bit about this. It gives you a new level of expertise and skill in the field of lifestyle medicine. What it does is it sets you apart from the people who, in the age of anti-social media, that there is a new fad diet coming down the chute every moment. And a lot of the personal trainers and a lot of the nutritionists and diet coaches, they all just regurgitate what comes down the chute. Today it's paleo, tomorrow it's keto, the day after carrots are carcinogenic, the day after please don't breathe because the air is polluted. There is so much voodoo out there. And so again, studying the science just sets you apart from the crowd. It provides you with a common language. And again, I said that we have this across the world. So everybody around the world who goes through lifestyle medicine education and certification starts to have a common language and common knowledge on how to address the chronic disease epidemic. You then create a global community. I mean, again, Johannes is obviously a key to bringing the whole world together in one place. And we do that obviously again through the Lifestyle Medicine Global Alliance, through IBLM, that we can create a global first as one community with one set of values, with one set of treatment modalities and with one set of science behind underlying it all. We're obviously, again, addressing the underlying cause of disease. So we're no longer just managing illness, but we're actually making a difference in people's lives again. And that in itself is obviously a huge motivating factor for healthcare professionals. So often we hear people, particularly older people, who have been practicing medicine for 30 years and they're so disillusioned with the system. They say, finally, I'm starting to make a difference in my patients' lives again. And that just increases satisfaction levels hugely. Obviously, we know that restoring health becomes more and more important as we talk about health systems and the way governments and national health bodies look at the whole the chronic disease epidemic, because continuing the way we do and spending the money that we do on managing illness rather than restoring health is simply not sustainable in the long run. Lastly, also, I guess it forces us as the lifestyle medicine apostles or evangelists to actually live this ourselves. You know, I couldn't sit here with a good conscience and tell you about lifestyle medicine without me trying to practice it every day myself. The way I sleep, the way I move, the way I eat, the way I interact with each other. And so that's, in my books, that's a huge motivator. So I don't become like the physician there on the right cartoon, right, who tells his patients that he's obese while he suffers from the same condition. Let's quickly look at how to get certified. We have two certifications. We have a physician certification and we have a doctorate and master's level health professional certification. One is a 150 question exam, one is a 120 question exam. We have a couple of prerequisites that you can see there. We need to have, obviously, you study an approved course that teaches you what you're going to test it on. And we need you to attend one of those. This is one of those qualifying events. Fellowshipping with your lifestyle medicine family, so you understand, you build connections, you understand what this is all about. Those are the prerequisites. You sit for the exam. We have it in various languages. And then you can call yourself a lifestyle medicine certified healthcare professional or physician. The way we run the exams is we have exam hubs all over the world that we partner with the National Lifestyle Medicine Societies, and they run the exams as an event. And so you simply rock up and we share income with those countries, because again, one of the key things is that without money, there is no mission. And so rather than asking countries to have huge membership fees, we simply allow them to share income from the certification exams, which provides the lifeblood for those lifestyle medicine societies. In countries without IBLM exam hubs, people simply go to a prometric testing center. And in the rare occasion where a country neither has an exam hub nor a prometric testing center, we offer remote proctoring too. But that is only if you don't have either or. A quick look at who is getting certified. This is my favorite slide. Those are all the exam hubs around the world. And you can see we have in every continent where we have exam hubs. At the moment, we've got over 6,800 diplomates. And in the US alone, we just closed registrations on September 30, and we had 1,423 exam registrants for the 2024 exam, which is an absolute record. And early indications show that the exam hubs around the world all have record signups to get certified. So people, the movement is truly moving, and it's wonderful to see. Here's a quick snapshot of the Lifestyle Medicine Global Alliance. There's about 30 lifestyle medicine societies from around the world who are part of this, and that obviously entitles you to organize your own exam hub and generate some income for your society. And again, apologies for the snafu on the slides, but hey, we finished on time. So very pleased about that.
Oh, thanks so much, Stephan. As always, you know, that high energy of yours is always wonderful. It's great seeing you actually a while ago in Qatar, so it was great. I think one of the things I want to just finish up with, because we have to kind of go, is that's kind of like what our mission with the summit here is. We want to bring together the community. And as you know, as you kind of mentioned a little bit, it's hard because everybody has slightly different visions, but I think it's very important. And that's why we support you so much, that there has to be an international standard, right? And that would be a unique. I believe it has to grow and expand, and we have a foundation now, but it's gonna get better as we move along. But I think it's really important, and brand lifestyle medicine as a very evidence-based is so important. So physicians, healthcare providers, people out there that want help, know that that's available. And it's not like, as you said, the woo-woo things, which are okay. I think a lot of us that see that they want to do good things, but obviously it is not the same than having a physician that is practicing lifestyle medicine. So
yeah, and I think the key is, as we are growing, first things first. Because right now we're talking about social determinants of health and, organic strawberries versus non-organic organic strawberries. And again, we just heard the previous speaker about proteins and whatnot. I think once we are sophisticated enough, we can start to do this. But, again, to use the words of one of my favorite presenters, Dr. Michael Gregory, the question is not organic strawberries or strawberries for breakfast. The question is strawberries and oatmeal for breakfast or bacon and eggs for breakfast. That's the question. And once we've answered that, and it'll take 20 years to answer this, right, then we can start to nitpick over organic versus non-organic and all of those other things. So again, the key is there is legitimation to all the peripheral things, but we actually must get the course right first. And again, we must do that evidence-based. And the reason why we say physician-led is not to devalue everybody else, because it takes entire care teams to take care of a person's health. But in the current system where everything is physician driven, if we do not include the physicians first and they do not come on board, we don't stand a snowflake's chance in hell of actually making a difference. And so again, in 20 years time, it might be different, but right now it's first things first.
And my opinion has changed a lot over the last 10 years about that, because I totally agree with you now that it has to be physicians and nurses and allied health professionals that need to learn this, because that's the only way to scale it big. And I do not accept 20 years. I'm sorry.
Okay. let's do it in 5.
I'm an optimist.
In my lifetime. How about
here
that?
you go. Well, that's 50 years, and then shorter.
Yeah.
Thank you so much, Stephan.
No worries. All good.
And,
thank you for having me.
Really
Be well.
appreciate it. Thank you. Thank you. Okay, guys, we're back again. Actually, yeah, we're back in like 1 minute. Hello, everyone. What a good time we have, right? I hope everybody has a good time. I definitely have. I just love it. I see so many passionate speakers. Now, next is Bruce Lipton. I'm not sure if I need to introduce them. Now, he allowed us to replay his last year's recording because he couldn't make it live, too busy. But you're gonna love it because it's just always an inspiration to talk about or to listen to him. So we're gonna replay. It's about 25 minutes and you're gonna love it. Stay tuned, stay present. Bruce Lipton coming up right now.
I am here and I'm delighted to be here with you because your whole premise, your whole reason for this program is to recognize the power that we personally have, and then how come if we have all that power, we're not experiencing the lives that we want, but what's going on?
What's going on exactly? You're going to tell us what is going on and how can we solve it. Let me introduce you in case somebody doesn't know you yet, which is very unlikely, but anyways. So Dr. Bruce Lipton, you are faculty of the University of Wisconsin School of Medicine, groundbreaking stem cell research at Stanford Medical School, famous for the book Biology of Belief, right?
A happy, healthy guy, you know, when I'm 79, no pharmaceutical drugs, all the pieces are working, and it's more than that, as we'll get into the discussion. This is part of what we were given as being humans, the opportunity to have a healthy, happy, heaven on earth experience. And I say it's not looking right, but we'll talk about that.
Yeah, we absolutely do. We absolutely do. So maybe can you talk about your groundbreaking research? Because I think that's where everything started for you, because you were very traditional medicine, right? Very much so. But then you found something. If you can summarize that,
Yeah.
especially for the health professionals in the field, right? That maybe haven't, looked at it that way yet.
Okay. Well, let's start with a very basic truth that people have heard their whole life, and that is knowledge is power. Let me say that in a more actually conventional way of looking at it today. A lack of knowledge is a lack of power. What you don't know has been disempowering you. What you have mislearned has also been disempowering. And the significance for me is simply this, is that I was teaching in a medical school, conventional story about genetics controlling our life and our behavior, etc. Now, what was I teaching? Stop for a second. Let's think about it. I was teaching the fact that genes control our character. And then I say, well, as far as we know, we didn't pick the genes we came with. And if you don't like the characteristics you have, you can't change the genes you came with. And then we add on top of this one that genes turn on and off by themselves. And I said, well, what does that collectively come down to? And it says, we perceive ourselves to be victims of our heredity. Whatever's running in our family, cancer, diabetes, Alzheimer's, whatever, heart disease, there's a tendency for us to have been programmed to believe that these health issues are derived from our body not functioning properly, and that if we take some pharmaceutical drugs that we're going to fix this whole thing. And that's a story of genetics, genetic control. Genes control X. I go, I'm teaching that, but I'm in my laboratory. I'm working on stem cells. Now, a lot of people have heard of stem cells. Stem cells, I was working on them in 1967, and there was just a handful of us in the world that even knew what a stem cell was back then. A stem cell, let me give you the real name of stem cell, embryonic cell. I go, what does that mean? I say, your body's made out of 50 trillion cells, okay? And every minute you lose 300 million cells die every minute. Blood cells, skin cells, hair cells, blah, blah, blah. And I go, what's the point? Well, how can you still be here if every minute you're losing, 300 million cells? And the answer is because in our cellular community, we have stem cells, embryonic cells, to replace the cells that die. So if you're worrying, do I have stem cells? Well, if you're here watching this program right now, well, then the answer is, yeah, you do have stem cells, because if you didn't, you wouldn't be here. So all of us have these cells. and I was cloning them. That means I take one stem cell, put it in a petri dish by itself. It divides every 10 or 12 hours. So first there's 1, then there's 2, then there's 4, then there's 8, then there's 16, and it doubles and doubles. And at the end of a week, 30,000 cells in the petri dish. And I go, yeah, but what's the point? All of them came from one parent. So that means 30,000 genetically identical cells. And I say, okay, what do? I split them into 3 petri dishes, 10,000 cells in each dish, but all dishes, genetically identical cells. We grow cells in something called culture medium, which we make in the lab. The most important fact about culture medium is it represents blood. So when I grow human cells, I say, what's human blood made out of? And that's the foundation of making culture medium, the fluid that the cells live in, the environment for the cells. Well, since I make culture medium, I made 3 slightly different versions of culture medium, A, B, and C, let's call them. They represent the environment that I'm going to grow the cells in. So I have 3 dishes, genetically identical cells in all dishes, but in dish 1, I use environment A, culture medium A. In dish 2, I use culture medium B, and in dish 3, a different culture medium C. I say, what's the result? In 3 days, in culture medium A, the cells form muscle. In 3 days, in culture medium B, the cells form bone. And in 3 days, in culture medium C, the cells form fat cells. I looked at these experiments and they were repeating and repeating, and it's like, oh my God, they're all genetically the same. What is different that causes muscle, bone, or fat? And the answer was the environment the cells were grown in, the chemistry. I go, oh, what does that mean? Genes didn't control the outcome. It was the environmental chemistry, the growth medium that controlled the outcome. I go, wow. And then now we want to jump to where it now becomes personally valuable, and simply this. You look in the mirror, you see yourself as a single entity. I go, no, you guess what? You're a skin-covered petri dish. Because under your skin, you have 50 trillion cells. And guess what? They're growing in the original culture medium blood. I go, so what? Well, what the results revealed is that the genes were controlled by the chemistry of the growth medium, the blood. So I say, it makes no difference if your cell's in a plastic dish or in a skin-covered dish. It's still controlled by the blood, the culture medium. And then comes the next question that is then changes everything. And it says, well, what chemistry should be in the blood? Because that's going to control the fate of the cells. I go, the brain is the chemist. But then comes the bigger question. So, what chemistry should the brain put into the blood? And the answer is profound and life-changing. I say, what is it? Whatever picture you hold in your mind, the brain translates that picture into complementary chemistry, which goes into the blood, and it's the chemistry of the blood that controls your genetics and behavior. And all of a sudden I said, well, then what does that mean? Your thoughts are translated into genetics and behavior. You're not the victim of the genes, you're the master of the genes. But the problem is dealing with the thoughts. It's the thoughts that change it. So like, if you have a picture of love in your brain, you're in love. I say, oh, you release wonderful chemicals, dopamine, pleasure, oxytocin, that bonds you to your lover. Vasopressin makes you more attractive to your lover so they stay longer. And growth hormone comes out. I go, that's why those chemicals give us vitality. That's why when people fall in love, they glow, they're healthy. I go, why? The culture medium is encouraging that, okay? But I say, well, wait, what if there's a picture of fear or stress? I go, oh, love chemistry is not released in that picture. In that picture, protection chemistry is released, not growth, protection. I say, like what? Stress hormones and things that affect the immune system and shut it down. I go, why is this relevant? I say, well, if you're living in a world of stress and fear, you're actually compromising your growth and your vitality. And guess what? 90% or more of health issues in this planet experiencing a health crisis everywhere is not due to the body, to the mechanism of the body. It's due to the consciousness of the individual, because whatever picture they're putting in their head, if it's not a picture of love, and it's a picture of stress. 90% or more of all illness on this planet is from stress. Less than 1% of illness is even connected to genes. I said, why is this important? We're the ones that control the stress. And therefore, if we're experiencing health issues or life issues and everything, it turns out your brain has been releasing the chemistry that interferes with your creativity. Because growth, where you use your conscious mind with wishes and desires, conscious mind, is separate than programs that are present in the subconscious mind. And the issue about this is, are you using your creative conscious mind to create your life? And I go, only 5% of the day. Because most of your life, 95%, comes from the programs that you got before age 7. I go, so why is this important? Well, let me first explain why 5% creative life and 95% program life. And the answer is this. The conscious mind, for a moment, consider your body as a vehicle with a steering wheel. And I say, if the conscious mind has got its hands on the wheel, it's going to drive you to wishes and desires. Okay? But if the conscious mind, and this is the monkey wrench, the conscious mind starts thinking, it's not looking out at the world. Because thinking is redirecting consciousness to the inside where thoughts are. So if you're thinking, you're not looking out, you're looking in. I go, what if you're driving the car and you start thinking? I go, conscious mind's not looking out at the road. I go, no, don't worry, because subconscious mind is autopilot. When the conscious mind is busy, the subconscious mind gets in, puts its hands on the wheel and drives. And I go, subconscious mind's 1,000,000 times more powerful a computer than the conscious mind. So in fact, when the subconscious mind is driving, you're a better driver than when the conscious mind is driving. And I go,
we all experienced that, right?
What's that?
Haven't we all experienced that driving? Oh, I'm arrived. I had no idea how I got there.
Exactly. And I said, because the subconscious took you there. So let's give a simple story because it'll play into our story. Let's say you and I are in the car and we're having a great conversation, blah, 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 blah. And what does that mean? When I'm focusing on the conversation, my conscious mind's not looking out the window. We're in conversation. So guess what? When we were in conversation, the subconscious mind took over and was driving the car. And I go, great, because I didn't want to say, hey, guess what? I haven't looked out the window for the last 5 minutes. That wouldn't have made your life better, but I won't say it. But I didn't look out the window because I was in conversation. But hey, the car's going. We didn't hit anything. We're still traveling. So I say, but now let's say what happened during that. And this is the critical point. You ready? What was I talking about? Oh, we talked about this and this and this and this. Next question. What was on the road when you were having the conversation? I go, I don't know. I didn't see what was on the road. That was the part that only after I stopped the conversation did I look out and notice, oh my God, I'm driving the car. And I go, so why is this important? You did not see your driving behavior. You didn't see it. Why? It was playing automatically. It was a program. You were the one not observing it. I go, guess what? 95% of the day, our entire life is run by the programs in the subconscious mind. And only 5% of the day are we paying attention and focusing on where we want to go. But 95% of the day, you ready? We're thinking. I goes, what's that mean? Thinking is not looking out. Thinking is looking in. When you have a thought, you're not looking out through your eyes. You're looking into your brain. So whatever is going on when you have a thought, you don't see it. I go, yeah, but what if I'm driving a car? What if I'm walking down the street? And I go, oh, the subconscious, those are programs called habits. They know how to drive the car. They know how to walk. They know how to talk. So I guess what? 95% of the day we are thinking, and our life is controlled by the programs. I go, oh, wait a minute. What the heck does this mean? And the answer is simply this. The brain is a computer. It's not like a computer. It's the most fabulous information processors that humans have ever experienced, and they can't duplicate it, okay? And I go, so what about it? And I go, it's a computer, the brain. I go, so what? Let's go back and look at the story when maybe a while ago, if you bought your computer a long time ago, we buy a computer and let's say we take it home and we push start and the screen boots up and I say, okay, got a brand new computer, let's do something. And then you say, I can't do anything. I said, you got a brand new computer. What do you mean? Oh no, first I have to put programs in the computer. Then I can use the computer. Oh, once you install the programs, now that's the foundation of the mechanism, you can type on the keyboard. That's when you put information in the computer. The hard drive in the computer is the subconscious mind. That's got all the programs in it. The conscious mind is the one that can type on the computer. But if the conscious mind's thinking, it's not typing anymore. It's back there thinking. And I said, that's when the subconscious takes over. And I say, and where's the problem with that? And here's the problem. Problem number one, only 5% of the day are you actually paying attention and driving your vehicle to wishes and desires. 95% you are playing programs. Part two, well, you're not looking out when you're playing your own program. I go, so what? Well, it turns out that the programming period of a child, which is the last 3 months of development in the womb, and then birth and 7 years, that's the program period. That's when you got your programs. And for the first few years, I mean, the last 3 months of pregnancy, the year from 0 to 1, the year from 1 to 2, the year from 2 to 3, you were being downloaded with programs, but you didn't see them. So I said, well, tell me the program when you got when you were 1. You go, I have no idea what the program was. I wasn't there. So I go, now let's look at this in understanding. 95% of your life is coming from the program, but you don't know the programs. Why? You weren't conscious when they were downloaded in the first 7 years. So I go, so why is this important? Because you don't realize when the programs are playing automatically, are those programs supporting you, the ones you got in that first 7 years, or are they sabotaging you? Well, it turns out we now recognize 60% or more of the programs downloaded into our hard drive subconscious in the first 7 years, 60% or more, disempowering, self-sabotaging, and limiting beliefs. I go, those are the ones that are running 95% of the day. I go, yes, they are. I go, well, if I was playing a disempowering behavior, I would see it. I go, no, you still didn't get it. Your conscious mind was thinking. It wasn't looking out. You're the only one that can't see your own behavior, because when you're playing a subconscious program, it's because you're not paying attention. So a story that might put this into perspective is you have a friend and you know your friend's behavior very well, and you know your friend's parent, and one day you see your friend has the same behavior as their parent. Of course, you want to tell them, hey, Bill, you're just like your dad. Back away from Bill. I know what Bill's going to say automatically. First thing Bill's going to say, how can you compare me to my dad? I'm nothing like my dad. When I say this in the audience, they all laugh. Why? They all have that experience. I go, no, you don't understand the profound nature of it, because everyone else can see that Bill's behavior is like his dad. The only one that can't see it is Bill. I go, wow, that's an interesting story. Now let's put the big topper on the story. You ready? We are all Bill. Every one of us is doing this 95% of the day. I said, what's the significance? I said, well, look, in my programmable period, first 7 years, you get your program by observing your parents, your family, and your community. In the first 7 years, you're not even conscious. The brain is operating at a lower vibration. And vibration, it's not new age. What I'm talking about is you put wires on a person's head, and it's called electroencephalograph, and I could read the brain functions, and they're in vibrations. For the first 7 years of a child's life, the brain is not operating at consciousness. It's below consciousness. It's operating at theta. I said, what's that? It's characterized as imagination. So I say, well, this is why kids under 7 can mix the real world and the imaginary world, because they're operating from theta. I go, that's why in the famous tea party, they pour nothing into the cup. They drink nothing. And it's like, well, that was the best tea I ever had. Or you're riding a broom because it's a horse. I go, point. Your mother says, give me the broom. And you look at her like, what are you talking about? Because it's not in your brain a broom. It's in your imagination, theta. It's a horse. So kids mix the two realms, imagination and real. But what people didn't recognize is theta is hypnosis. And I say, why? I say, How many rules does it take to be a functional member of a family? Oh, how many rules does it take to be a functional member of your community? You can't do what you want. You have to play by the rules. I said, what are the rules? That's what you programmed in the first 7 years by copying others. I copied my father, and that's how I got the rules to be who I am. And I go, yeah, but now there's a problem. I say, what? My father and mother had a very dysfunctional relationship. So when it came to download, by observing my father and my mother's behavior, what do you think? I learned how to create wonderful relationships? No, they weren't the model of that. I downloaded their dysfunction. I say, so what was the problem? I say, well, 95% of the day, I'm thinking and my behavior comes from my subconscious. And if I try to get in a relationship, what kind of dialogue, what kind of behavior am I going to reveal? I'm going to say, my father's behavior. That's the program. And 95% of the day I'll be playing it. I guess what? So dysfunctional, I couldn't get a relationship off the ground for 45 years. Why? Because unconsciously, like Bill, I played the program, didn't see I was playing a program, only saw that it wasn't working. And I go, okay, let me help people here for a moment, because I said you were programmed before you were conscious, and you have really no awareness of the programming for the first 3 years, essentially. And I say, so why is this important? I say, because those programs are controlling your life. I say, well, guess what? 95% of your life is coming from the program, because that's how much time you're thinking. So I say, so what? Your life is a printout of your program. I go, what does that mean? I go, the things that you like that come into your life, they come in because you have programs to acknowledge those things. But now listen, the things that you want and you strive for and you work hard, you put a lot of effort into it. I'm sweating, man. I'm going to make this. I'm going to make it real. Why are you working so hard? You ready? Whatever that destination you were seeking, you're struggling to get that destination, not because you can't have it. You're struggling because your invisible behavior that you've been programmed with is sabotaging you. So all of a sudden I say, what are my programs? I say, look at your life. The things you have to struggle over, that's because those programs don't support, your programs don't support that destination. That's why you struggle. And so all of a sudden it says, oh my God, I'm having trouble running my life. I say, yeah, because you're not creating, you're using program. And I like to bring this in because most people have seen the movie The Matrix. I go, ooh, is that science fiction? I go, no, Matrix is a documentary. What do you mean? I go, premise, we've all been programmed. I go, that's not a premise. That's reality. Everybody's been programmed before age 7. And I go, and there was a great part in that program that we need to wake up to because it's a documentary. And I said, what was it? There was an option to take something called the red pill. I go, what was that? I go, that would take you out of the program. And if you get out of the program, which has been sabotaging you 95% of the day, you can start to create the world you want, not the one the program was creating. Guess what? Falling in love is the red pill. I go, what do you mean? I go, well, let's say your life is blah, 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 playing program every day, blah, 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 blah. And then you meet somebody, you fall in love. 24 hours later, you're, oh, life is so beautiful. Everything, oh, the world is great. The food's great. The music, even the job is not crummy anymore. I'm having a great life. Wait, blah, blah, blah. And in 24 hours, you have heaven on earth? How'd that happen? You ready? Science has recognized when you fall in love, you stop thinking. You stay what is called present. You stay what is called mindful. For a very simple reason. You've been looking for this person your whole life. They show up. Is this a time to think and disconnect? I go, no, that's the time to stay here. You stop thinking. I go, then what? Then your life was not being created by your program at that point. I said, then what was creating my life? I say, the conscious mind. That's the one with the wishes and desires. What did you create? Honeymoon, heaven on earth. I go, wow. It was always there. The only reason you don't experience it on your regular day-to-day basis is you're not operating from your conscious mind. You're operating from the programs. And most of those are disempowering, self-sabotaging, and limiting. So all of a sudden it's like, wow, I have the opportunity to create the life I like. Yeah, when I fell in love, I did. And then it broke down. I say, why? When you stopped thinking, you kept playing only from the wishes, desires, conscious mind. But at some point, thinking has to be air. Why? Life is busy, man. You have responsibilities, jobs, chores, things you have to do. So I say, then what happens? You're in the honeymoon. Why are you in the honeymoon? You and your partner are both creating from conscious mind, which is wishes and desires. You manifest honeymoon. Then I say, but what happens if you're down the road a bit and you start thinking? I go, oh, the moment you start thinking, the behavior you're playing is not you. It's the program you got. And 60% of those programs are dysfunctional. Will you see it when you play it? No. Why? Because you're thinking and you're not observing, but your partner sees it. I go, oh, well, you and your partner got together because both of you were creating from wishes and desires of the conscious mind. You both created that. When the subconscious mind kicks in, that's an intruder. And it's not you, it's your program, but you don't see it. And those invisible programs that you were playing sabotage the relationship. And then the honeymoon goes out the window. Why? Because you're no longer creating from the conscious mind. You're now putting the programs back in, and they throw that monkey wrench into you. So it becomes really important to say, yep, there was a red pill. Most of you probably had experienced it for whatever period of time, a week, a month, few months. Those were the honeymoons. I say, that was not an accident. That was your creativity. And I want to let the questions come, but I got it. I'm on this flow, so I just want a couple of more things and we'll get it out of here. And the flow that's so important is that we were really designed to create our lives, but we got programmed. I say, well, that's relatively new. Matter of fact, it was in 1927, and they introduced the new science, quantum physics. And let me put this information here. Quantum physics is the most valid of all the sciences we have on the planet. I go, so listen to this. Principle number 1 from 1927. Consciousness is creating your life experience. I go, wow, what does that mean? Change your consciousness and you change your life experience. When you fell in love, you let go of the programming of your consciousness and fell into the creative consciousness, and their life changed instantly right at that point. So this is a rule of physics. You say, well, that was 1927. I go, guess what? Quantum physics reveals that physical universe, physical matter is an illusion. We can get into that, but I don't know how much time we have, but we'll get into that. And I go, everything is energy. And I go, yeah, and consciousness is energy. And so there's a paper I use from the most prestigious scientific journal on the planet. It's called Nature. And it's an article called The Mental Universe by a physicist, Richard Conn Henry. And I say, when I'm in a lecture, I don't show people the material in the article. I say, it's all summed up in the last sentence, and recognize this is the most truthful, valid science. And the conclusion of the paper is, you ready? The universe is immaterial. It's made out of energy. The universe is immaterial. It's mental and spiritual. Live and enjoy. And I go, this is not philosophy. This is science.
Hello, welcome back. Isn't that amazing to listen to Bruce Lipton? For many of us, thought-provoking, or what did he exactly say? How does this fit into my worldview, my perception of reality? It's just great. And I think I invite everyone to just open up to kind of see what that does. And does it help us to live healthier, happier, longer? That is, I think, what we want here at the summit, to be inspired to think outside of our box, right? We all have these boxes, and I think we want to expand and become better, more conscious, and better in what we do. So let's see. Now, our next speaker, Dr. Dysinger, somehow couldn't make it, or he's, I don't know, we haven't heard from him actually, but I'm sure he's on his way. So what I do is, let's talk about, actually, let me ask you guys, would it be okay, we have about 15 minutes or so, that we actually go through a lifestyle prescription for you guys? Meaning, type in the chat box, yes, yes, no, not at all. Meaning that we go through a process that many of our health coaches, practitioners do to specify a very specific micro habit lifestyle prescription. And then you take that, you write that prescription for yourself, right? Digitally here, you do it yourself, and then you practice it, right? Not like I said in my earlier talks, it's not really about so much, well, do I know everything about it? No, it's about practicing that habit. It's the only thing I'd like you to focus on. So you guys ready? Good. I get a lot of yeses here in the chat. That's good. And even if you watch the replay, please follow through, right? This is important. So the first thing is, let me share here slides. Oh no, I actually have it. Oops, sorry. Let me do it again. Okay, if you can bring the slides in. Okay, and talking about, many of the physicians, Dr. YAMANI said, well, all we do is prescribe medicines, right? Pretty much. Well, that's good, but it needs upgrading. So the vision is that we have at Lifestyle Prescription University is that every single physician in the world has a prescription pad for pharma, for medicines and so on, and they have a lifestyle prescription pad. And then there's a choice. Right now, we as patients do not have a choice. That's why I always say, talk to your doctor. You want the choice. You demand lifestyle medicine. You demand, hey, do you prescribe lifestyle medicine for what I do, for my health issue, right? You have to ask for it. And that creates the groundswell, and hopefully the rest follows along. So, very simple. What I'd like you to do, pick one of the pillars, right? So, I don't have the slide here right now, this PowerPoint, but pick either a dietary improvement that you like, pick an exercise improvement that you feel is really needed, or it has to do more with the social kind of support, love and support, or with stress management, managing stress better. Or let me ask you, have you practiced in the past a habit that you felt really good about, that just pops into your head right away, and yeah, I did this for a while, it was really helpful, but now I haven't done it for a long time? And it could be something you want to do or something you want to remove, right? It's always you want to remove pain or things that are not good for you, or you want to make it very easy to do things that are good for you, right? So everybody pick one. And just for the purpose of this exercise and this first lifestyle prescription that you're gonna practice, make it really, really simple and easy. I want you, when you think about that new habit that you're gonna practice, and let's time it. Let's say you do this for only 7 days. I do not want you to do it longer. Only 7 days, right? So that's easy. And I want to make it so you want to make it so easy that when you think about that habit, to practice it, not think about it, practice it, do it for 7 days. Did you say, yeah, it's easy, I can do this? And I help you also how to do that, how to make it even more, yeah, I'm ready. Okay, so type in the chat box if you have that habit. Type in the chat box if you have that habit, and either type it in the chat box if you're okay with that, or you write it down yourself, right? Now, the next thing is I'd like you to look at it and say, do I exactly know what it is? Is it too complicated, too big, too not clear enough? So chunk it down, meaning make it simpler, make it more precise. So for example, if you say, oh, I want to eat better. No, that's not going to work. You have to say, you have to write it very specific. Make it micro too, small. Okay, here, good example, if I don't mind, in the chat box, strength training. Okay, that is too vague, right? And that's why often we don't follow through, because we actually, what does that mean, right? Make it very specific. So when I ask you, how, first of all, what is it about? And then how you're going to do it. Stress management, I need something way more specific from you guys. Come on, go for it, go for it. Make it specific. Stress management could mean I'm meditating 10 hours a day, or it could mean I take one conscious breath a day, right? What is it that you're going to do? We need to be specific. So you know, and if I ask you, you can explain to me exactly when are you going to do it, how you're going to do it, how often you're going to do it, right? Meditate every morning for 10 minutes. Okay, that's good. Mary, maybe make it even more specific. Say, well, when? Or at least in your mind, right? Did you know, when do I do that? Because that is typically the problem. We want to meditate 10 more, or do a mindfulness meditation or relaxation master or yoga or whatever. We want to do it, but how do we fit it into our daily lives? That is the block for most of us, right? So if you say, I brush my teeth, wash my face, and right after that, drying my face, right after that, I sit down and meditate 10 minutes. And there's nobody there that can take attention away. That's what I do. I have my space, right? You have to build it. And actually what it does, if you do it this way, it's going to stick. For example, one of the things that for me, lately I do weight training more, right, for quite some time, but then I kind of forgot about it, right? And now what I do, I have the weights, I put it there so I cannot not see it in the morning, right? And so I almost fall over it. And I noticed it's a huge difference if when I walk out of the bathroom, for example, go in the living room or in my room, and then it's oh, weights. The visual seeing them triggers me to do it. I just grab it, bam. Right? So make it specific, everybody. Come on, give me more, give me more. Get to bed by 9:30. Perfect. How do you know? What do you do before that? What triggers you, right? Set a trigger up for yourself. Set up a trigger. Set up a trigger. What triggers you automatically to do it? See, habits are not a conscious kind of thing or decision in a sense, or it's a conscious decision that we need a conscious decision to do them at the beginning, but we want to automate them, like brushing your teeth. Do you think about it? No, you go to the restroom or bathroom and brush your teeth in the morning. And so the more we automate it, the more it's clear to your conscious and your unconscious mind what you're going to do, the more they stick. As people say, it's like takes 6 months, 3 months to install a habit. I totally disagree. It does if you use only willpower. But if you use an automation process to habitually automate your habits, it can be very, very fast. Okay, so everybody has it. Type in the chat box if you got it. And here on the slide, if you look at this, I ask you a few questions, and I want you to think about this just for a sec. And I want you to feel it in your body, right? Not up in your mind. Go with your awareness in your body and say, Well, so why is this important? I'd like you to scale that or to measure it. So when you think about this habit that you're going to practice, like I meditate every morning 10 minutes. Here I do yoga in the morning after the shower right away. Exactly. Specific. And I do it for 7 days, right? Now, why is this important to you? What's in it for you? Why would you want to do that? I'd like you to really bring up something that is so passionate, so full of energy that you say, yes, I'm a 10 out of 10. This is important to me, whatever the specifics are. But I know it's important. I feel it in my body, in my chest, in my heart, in my gut. Type in the chat box, where are you? And if you're at 5, 6, or 7, that's fine. But improve and make it as important, as passionate, as high energy as possible. From 0 to 10. Give me a 0 to 10. 0, no, I'm not going to do it anyway. 10, yep, I know I'm going to do it. And anything between. Yeah, everybody has that? The why we do things. Why is about motivation. What's our motivation? What's our benefit? What do we get out of it? And review again. So what will you do, right? Make it specific. SMART means that's used a lot in terms of habits and goal setting. It has to be specific, measurable. So how do you know you've done it? For example, if I push weights, I know I've done it or not, right? It has to be achievable. So I'm not going to push like 100-pound handles or whatever, right? I couldn't do that probably. It has to be relevant. It has to be important. And it has to be timed, which means 7 days. I want you to practice this only for 7 days. Yeah? Everybody ready? So when you have that, great, 8, 9, 9, 10, super good, great. Now comes the important part. Write a lifestyle prescription for yourself. Now, if you have a piece of paper, write my lifestyle prescription, write the specific habit you're going to do, and sign below. So it's an agreement, right? You make an agreement to yourself. Your full system, conscious, unconscious mind, you know what you do, and then put it somewhere where you can see it. Maybe on the mirror or, on the entrance of the door or something like that. Perfect. Great. And tools like reminders are really helpful. Actually, we're finalizing we have an app that's coming out, Lifestyle Medicine Works app that has that. Basically, first you can chat with coaches if you have a coach, but second, most important, you have a lifestyle prescriptions that you write yourself or with the connection with a coach. And basically you can set reminders and update them and check them off if you've done it, right? So it's so helpful. Set a reminder, or if you want to do it on your phone, that's fine too. Okay. Type in the chat box and confirm with me that, yes, I got it. I'm ready. I'm at a 10 and you've wrote your lifestyle prescription. So confirm that, please. And by the way, I'd like you to basically just focus on that habit. Just for kind of practice purposes, right? Do you start to, let me check how that goes. Can I automate it so much? And if I say don't do it for more than 7 days, if it's automatic, continue, obviously. But keep it small, micro, easy. And that's the secret that we found works so well. Knowing why you need this needs to be done, why that habit is healthy for you, what specifically is it, right? And then how am I going to do it? How do I integrate it into my life? When, how, and so on. What's triggering me to run this habit? The analogy is just great. Think about your smartphone, right? Install something new, like Bruce Lipton said. You want to install the old habits, the old programming, change it. People change it. We change our habits all the time. Got it, wrote it down. SAADIA, great. Perfect. Great. Thank you guys so much. So I hope Dr. Deisinger can come next few days. I hope he can make his work. It's great leader in lifestyle medicine. And I think we're going to be back in about 2 minutes with our next speaker. You don't want to miss that for sure. Hello, we are back. How was that? Writing your first lifestyle prescription. Can't wait to hear your feedback, even let's say on day 7, right? So thank you again for being back. I hope you're having a good time here. We definitely do. And to tell the truth, I just put these summits on for my pleasure. No, obviously not just, but it's great to have all these amazing speakers. And our next presenter is a leader in mind-heart connection. Topic is the science of the mind-heart connection. And so I welcome Dr. Jonathan Fisher.
Hi, Johannes. Good to be with you.
Good to be here. Well, we have almost the same name, right? Kind of like
Yeah, very similar.
Jonathan and Johannes. There we go. So thanks again for being here. And let me introduce you quickly. So best-selling author, just won heart, cardiologist, organization well-being leader, educated at Harvard and Mount Sinai. And, you know, you've made this your passion, basically, to talk about the mindfulness, the mind-heart connection, especially in healthcare with physicians. I know you're going to talk about that. So thank you so much for being here. Really appreciate it.
What a pleasure. What a pleasure. This whole event, I know the effort that goes into organizing it, so I have to applaud you for the work that comes from your passion. It's helping so many people, and I'm honored to be here.
Thank you.
I have been practicing medicine for 26 years, and I've seen a lot of changes. And I would say that the changes have involved a shifting away from the heart and the human-centric side of practice that I witnessed as my own father practiced in our house in suburban New Jersey. He was the town doctor, and there were no specialists back then. So he was a healer of hearts and healer of minds, and he ran blood tests and stress tests and everything. And he inspired his 7 children all to become doctors just like him. And that's why this work for me is not simply a job. This is a calling. And I'm called now to address some of the shifts that I've seen in healthcare, particularly around how we pursue health. This was a selfie that I took when I was a fellow at Mount Sinai Hospital many years ago. And if you look into the eyes of this young physician, you are not going to see joy, and you are not going to see someone who is satisfied or even who felt like he was living his purpose, which he had set on the road for many years before. Beginning in my first year of medical school, like so many of our colleagues in medicine, there's a gradual erosion of our natural empathy. There's a gradual division of the calling of our heart to help other people heal, so that at the same time we become unhealthy and we start to pursue habits that we certainly wouldn't recommend for our patients or even for our close friends. And this is why so many doctors, as we're struggling from burnout, which is affecting 40 to 50% of doctors around the US and around the world who I've spoken with, it makes it even harder for us to be leaders in this space of health and healing. Not to mention, traditional medical education has long ignored the core pillars of holistic health, healing, and even well-being and happiness, which I'm going to make the case that these are deeply integrated. As I see it, we have a crisis now in our society and in our world, which involves 4 dimensions of the human heart itself. And these 4 dimensions are inextricably linked. And Professor Ellen Langer at Harvard makes the case that we shouldn't even talk about the mind-heart connection, because that implies that it's possible to disconnect them, when in reality, there is a unity of mind and heart. And it is this unity that's disrupted, creating a crisis on 4 fronts. The first is the physical. We see 18 million heart attacks each year, and the number is rising. And I'm going to speak about cardiovascular disease, but you can extend this to any disease, whether we're talking about lungs or cancer, hematologic malignancies, diabetes, obesity, etc. Rates are rising, and there has been a tripling of rates of obesity and diabetes over the last 30 to 40 years, with concomitant rise in cardiovascular risk. We're also sedentary. About a quarter of us around the world are not getting anything near the recommended guidelines for exercise and fitness. Our emotional hearts are also in danger. Anxiety affects between 10 and 20% of the population right now. Worldwide, depression impacts 5% of us. Importantly, 75% never seek help for depression. And for those of us who are working in the field of lifestyle medicine, preventative and holistic health, we realize that the challenge that we face is not simply checking a box to follow a prescription, to meditate more or exercise more or eat an extra carrot. The problem runs much deeper than that. When we have deep emotionally wounded hearts, both on the individual level, societal level, and the physicians, nurses, and coaches who are trying to do the help themselves, who are burning out with their own emotional wounds, which makes them less capable of helping others effectively. Our social hearts are in danger. U.S. Surgeon General Vivek Murthy has spoken about the crisis of loneliness. And we know, and you may have heard, that loneliness is equivalent to smoking 15 cigarettes a day in terms of its cardiovascular risk and the damage, the literal physical damage that our cardiovascular and whole body system can suffer as a result of missing out on that core human need of connection. And the causes are many and the solutions are many, and we can touch on them. I believe that at the root of all of this is something deeper that we're told not to talk about in health and fitness and wellness spaces. It's a taboo subject, and I think it's a disservice that we're taught not to talk about the spiritual. And by spiritual, I'm not talking about religion or any particular dogma or text or deity. What I'm speaking about is the secular understanding of spirituality, to put it somewhat ironically, the understanding of palliative care medicine, which is spirituality in the sense that we feel connected with something much greater than ourselves. Could be nature, could be a God, could be the common human energy and spirit that runs between all of us. Spiritual life is on the decline. We are a society that is seeking a deeper meaning. And yet cynicism is on the rise, and this has a corrosive effect on our cardiovascular health. Now, it wasn't always this way. There was a time when human health was not seen as something disintegrated. You wouldn't have to see a medical doctor for a medical problem and a healer for a healing issue and a psychologist for an issue with the psyche and a spiritual leader for a spiritual crisis. They were all connected, one and the same. And the image on the screen now is from traditional Chinese medicine. And this is the symbol that means Xin, X-I-N, which is not heart. And it is not a symbol of the mind. It is a symbol of the unity and inseparable nature of the heart, mind, and spirit. And this is the mind-heart, which is a unity in traditional medicine, not just in Chinese practice, but in every wisdom tradition of the world, going back 3,000 years or more, whether it's the yogic or Ayurvedic traditions. We see that there was a traditional unified view of health and healing, which has disintegrated. If we look further in the Japanese tradition, this symbol also is kokoro, which means mind-heart. And when we combine the symbol with the symbol for here and now, what you see is the kanji, or symbol for mindfulness. Mindfulness is it's one of the 8 pillars of a Buddhist practice, which I believe was focused on healing in the holistic sense. And this was the message that we must bring our mind-heart unity into every moment in order to be fully present with our body, be fully self-aware and aware of others, and respond appropriately to what needs come up. So how did things change? I'm fascinated by this. I've researched the history of the mind-heart connection, and it begins with the Roman surgeon Galen, who dissected a human heart, well, actually dissected cadavers, non-human cadavers, and described that he did not find a spirit inside. And he gave birth to the modern field of cardiology, which advanced in the Enlightenment, thanks to William Harvey and Vesalius and others, showing that the cardiovascular system certainly looked like a simple pump with pipes. Fortunately, there has been a reconnection ever since Descartes famously said, "I think, therefore I am," and he developed a dualistic approach to the mind and heart, the mind and spirit. And now, through the work of Bruce Lipton, who spoke earlier, and many others, we see that there's a rejoining, a return to a deeper and wiser understanding of how we can approach health and healing. There's a rediscovery, and this is just in the last 30 to 40 years. Now, for me, when I was a medical student, there was a young woman who came into the emergency room with what looked like a heart attack. But it didn't make sense because she had no risk factors whatsoever for cholesterol or blockages or inflammation in her arteries. And it turned out that she had no blockage in her arteries, even though her heart was literally breaking as we were watching it become weaker on the ultrasound screen. And she had what is now known as the broken heart syndrome, which is the pinnacle, the sine qua non of the mind-heart connection, the most extreme case showing that emotions of grief, which she was experiencing because her daughter was readmitted to a drug rehabilitation program, feelings of grief have a direct negative impact on the cardiovascular health and function. And so I became curious, and I started to ask the question, among the spectrum of dozens of human emotions and hundreds or even thousands, if we look at all of the combinations of emotions, which of those have the most robust research and evidence showing that they can drive cardiovascular and general health disease? And I've come to call these the heartbreakers, because in their extreme cases, they can literally break or decrease the function of the human heart. And these include, as you might guess, stress, burnout, a negative outlook or pessimism, anxiety, panic, depression, anger, hostility, grief, and injustice. Now, the world of medicine has, for many decades and even a century, taken what I would say is a negative, reactive view towards well-being, which is focusing on disease and reactive treatment of disease rather than preventative, proactive health pursuit and healing. And so I began to explore the opposite of the heartbreakers and ask the question, which emotional states in our patients and our clients and those seeking health, wellness, and well-being, even in ourselves as doctors and nurses and coaches and psychologists and social workers, which emotional states can not only help repair the damage done, but actually promote healthy physiological states. And I've now come to see these as the heart wakers, because they not only wake up the physical function of the heart, improving blood pressure, heart rate variability response, but they also lead to an awakening on a much deeper level, on a spiritual level. And every wisdom and spiritual tradition has explored how we can wake up our hearts in every sense, not just the metaphorical, but now I'm making the case that this is literal benefit for the physical heart as well. And these emotions, which have the greatest amount of research behind them, include gratitude, optimism, kindness, generosity, joy, laughter, purpose, compassion, and love. And these are heart-centered emotions. So as we are moving forward in the conversation, I'm inviting you to think, how often do you experience the heartbreakers in your life? How often do you experience the heart wakers? And how skillful are you, not only in managing your own emotional state, but in helping others regulate theirs so that they can pursue the pillars of lifestyle medicine more effectively? Now, the question that's most fascinating here is, how is this possible? How can something intangible, immaterial, immeasurable, like a human emotion, cause a physiologic change, ultimately leading to dis-ease and even heart attack and death? And there are two broad mechanisms. The first I'll call intrapersonal. There's a constant bi-directional, two-way communication happening between the mind and heart, the heart and mind. In every moment when we're experiencing a thought, a feeling, a memory, a sensation, there are correlates that are happening in our body. And in a moment, I'll speak about what I consider more of a horizontal interaction, which is interpersonal connection. Focusing on intrapersonal, the science is clear. There are three broad mechanisms by which the mind and heart are in constant communication that drives all behavior. And number one, there are changes in the mind. So thoughts occur. Emotions arise in the body, these visceral primordial, primal urges that send signals to the mind that are then interpreted and transform into feelings, which then drive impulses. And then there are brain centers, the hypothalamic pituitary axis, sympathetic nervous system by way of the vagus nerve, that release a flood of neurochemicals, which then lead to step 2 on this pathway connecting the immaterial with the material. And step 2 in the pathway are physiological changes in the body itself, looking at the heart in particular. Certain emotional states and certain neurochemicals, cortisol, dopamine, adrenaline, can drive an increase in heart rate, increase in blood pressure, decrease in heart rate variability, which is associated with sustained stress response and lack of resilience, both physical and emotional. And on the flip side, we have the heart waker emotions that we discussed, which release their own neurochemical cascade, including GABA and oxytocin and endorphins, which have the opposite effects of lowering blood pressure, lowering heart rate, increasing heart rate variability, not only real time, but also sustained over time. And there are changes in other organ systems, including the immune system, gastrointestinal system, respiratory system, simply by virtue of this cascade of thoughts, feelings, memories, emotions, and impulses, which are transformed into physiologic changes. And the third link in this pathway within ourselves is simply behavior. Based on the physiologic state that's now arising, we make certain choices. Our repertoire of decisions either becomes narrowed and constricted when we're in states of stress, or becomes expanded and creative and responsive rather than reactive when we're in states of calm with, for example, vagal nerve activation. The ventral vagus branch is active. We enter in a state of calm, receptivity, openness, and creativity, and especially empathy and warmth. And these, as you can imagine, will determine whether our choices, actions, and behaviors are health promoting or health sabotaging. Now, I mentioned that there is both a horizontal moment-to-moment change based on what's happening in our mind, but there's also a horizontal one, rather. There's interpersonal connection. So we are having our own mind-heart connection in every moment, and there is a transmission of our mind-heart state and an impact on the mind-heart state of others. And we, as healers, doctors, nurses, healthcare leaders, coaches, and human beings with families, are at great risk if we neglect or ignore the impact that our physiological state has on those around us, whether we know it or not. And while some in the New Age space like to invoke the heart's electromagnetic field as a primary actor, as a cardiologist, I have to say that that's not the primary driver of how my emotions affect those around me, how my state of calm can help calm a patient and put them in a state of healing, or the opposite, how my state of agitation can create a state of agitation in others. There are much more notable, measurable, and impactful forces at play, and they begin with nonverbal expressions, micro expressions, the corners of my eye, the corners of my mouth, the tone of my voice, my body posture. Before I speak a word, if you and I are meeting, or if you are helping someone else in the healing process, these nonverbal cues have a powerful impact on the physiologic state of the person that you're with. And the ripple effects only begin there. Because then there are synchronies that occur as a result of these nonverbal cues, such that someone else's eye position may begin to subtly match where my eyes are gazing. My body posture may serve as a cue for someone else's body posture. Someone else's breathing may start to synchronize with mine at a subconscious level, which then affects their heart rate variability, vagal nerve activation. So there are nonverbal cues and nonverbal synchronies that occur between individuals where my mind-heart state affects yours, and it can lead to healing or the opposite. And then, of course, there's the physical contact. A simple warm touch in a healing encounter, a therapeutic encounter, can activate the mammalian cuddle response and release oxytocin in the person that we're touching, holding, embracing, hugging, caressing, which has its own health-promoting effects, independent of any behavior. And then there's the cognitive piece, where there is some controversy, but there are mirror neurons, which were described in the 1970s and 1980s, where these may be responsible for allowing us to create mental maps and models of the world that match the person that we are with, encountering. And also there's the well-known phenomenon of emotional contagion, where my emotions have a direct and even often subconscious impact on the emotions of others, which changes their physiology just by the mechanisms we spoke about on the previous slide. And then, of course, this can be broadened into the group dynamics, where we know that when a chorus is singing in harmony, in unison, there is a tendency towards heart rate unity and heart rate variability coherence. There's a direction where everyone's hearts move in sync along with their singing or prayer or breathing. And then, of course, there is simply the healing power of being in a group with others, which may explain why spiritual communities have better health, cardiovascular and otherwise. And then finally, consider your use of digital media, which is the main way that we interact with others, and the simple emojis that we use, whether it's a heart emoji or the opposite, and how that has an impact on us without words. What does all of this have to do with lifestyle medicine? Well, hopefully I'm making the case that our thoughts, feelings, emotions, and beliefs can have either a detrimental or salutary effect on our health in every dimension, but they also impact our ability to make decisions, to change our habits, to recognize self-sabotaging behaviors and to address them directly. And so I see lifestyle medicine as living at the intersection, the nexus between our mind, our thoughts, behaviors, emotions in the mind, and the heart in its four dimensions, the physical, emotional, social, and spiritual. And we can go into a much longer conversation, and you already hopefully can see now how the state of our heart and mind really lies at the root of how we manage our stress, about how we approach sleep, and both the nighttime and daytime habits that set us up for sleep, and our physiology while we're asleep, whether we remain asleep. They affect social connection and our ability to connect with others, our desire to connect with others, our sense of whether others are safe or a threat. They impact our nutrition and dietary choices, our desire to be physically active or remain inactive on the couch, and our choice to use other substances, whether for social purposes or to escape from those unpleasant emotions that we all experience from time to time. So how do we strengthen our mind-heart connection? I find it helpful to approach it in the four dimensions of the heart. The first is the physical, where of course we follow all the pillars of lifestyle medicine, which you're familiar with. We become active. We make healthy food choices. And we also seek regular medical care and have appropriate testing. We look at the emotional heart, asking ourselves, what emotions predominate in my life? And how do I experience my own life? Is it one filled with fear, shame, regret, and chronic stress and burnout? Or is it a life filled with joy, meaning, and connection? I'll call on you today to take stock of, take account of your social connections without judgment. Have you invested your time, attention, and even love in the connections of those around you and created communities of belonging that are the greatest predictor of health and longevity? And finally, there's the spiritual heart. Are you living according to your purpose, whether it's your purpose in life or your purpose today? Have you set an intention for yourself? Not about the things you want to do today, but how you would like to be today, to show up for yourself and for others. And in closing, I'll call on one of the many, many pieces of wisdom that we can learn from the heart itself. Now, the heart, as you may know, serves the rest of the body. It lives its life in service, 100,000 heartbeats a day. But what you may not know is that the first few ounces of blood that leave the heart are not in service of the brain or the other vital organs. In fact, they return directly via the coronary arteries back to nurture and nourish and support and strengthen the heart itself so that it can function in a sustainable way. So as we finish this conversation, I'll invite you to remain committed to serving others and the communities that you belong to and the organizations that you support. But at the same time, simply remembering to be like the coronary arteries and to nurture your own heart in all of its dimensions. Thank you so much for your warm attention. And I would love to stay connected with you and in contact on social media. And if you're interested in learning more, I've spent 26 years preparing to write this book called Just One Heart, where I summarize everything we've discussed today and go into greater detail. Thank you.
Great book, everybody. Please get it. It's really good. Dr. Fischer, thank you so much for the presentation. Amazing and so important. Let me check on some questions that I think we had. Can you elaborate? Maybe one is around, well, how do we practice that if you're physicians or just general, right? Anybody that has health issues or wants to connect more. Can you elaborate more in this? What specifics you would suggest and the details, the fine-tunement of this? Because I think many of us have tried, but then we didn't do it or we didn't follow through because maybe it didn't see results or whatever. Can you talk more about that?
Yes, Johannes, to be clear, the question is around connecting more. Is that correct?
Yeah, exactly. Yeah. How to do that and some of the tips you can give everybody.
So I would begin with a bit of a radical proposal, which is go back to your childhood for a moment and ask how connected you felt in your own original environment with your parents, with your friends, with those around you. How safe did you feel? How trusting were you? Were you nurtured and supported, or were you always trying to have to prove yourself and validate yourself so that others would accept you and love you and care for you? Because many of us carry around for decades this old belief, this old driving force that we believe that others cannot be trusted completely. And when that is at our core, we can try as we will to make friends. But often we don't trust ourselves and our own emotions. We don't trust our own intuition. And if we're being honest, we may not even love ourselves. So I would suggest looking at our traditional relationship with others in the past. What lessons have we learned? What messages and signals have we gotten? And what meaning have we made of that? And if it wasn't to our liking, as many of us maybe had a parent or parents or friends who taught us the message that it's not okay to be open and vulnerable with others, we can then reparent ourselves. We can treat ourselves as we would wish to have been treated, with deep empathy, compassion, and love, and practicing self-compassion, beginning today as the starting point for reconnecting with others.
Is that also a fear of being weak? Is that one belief that, or one perception, to not allow that heart-centeredness to grow?
That's very much a cultural dependent. So there are some cultures where women and even men are allowed to show the whole spectrum of human emotions. But the United States and the Western world in modernity are not one of them. And so the tradition is that we should all be independent, and that independence requires strength, and that the sign of strength is closing off and not showing our emotions to others. And I blame that on a misinterpretation a misinterpretation of Stoic philosophy, where people think that the Stoics, who practiced 3,000 years ago and are celebrated for being so wise, were arguing that we should never show our emotions. But that's actually incorrect. That's not true, and it's not healthy. And so there is this belief, false belief, I would say, traditional model of strength involved closing our emotions off from ourselves and others. But as you all know, when you try to hide or suppress or put aside certain emotions, whether it's anger, resentment, or fear, they always have a way of showing up. So I would strongly encourage us to redefine what it means to be strong and courageous, which actually means to be open to experiencing our emotions, asking for help for those that are challenged, and sharing our emotions with those we love and lead.
What an amazing closing remark. Thank you so much, Jonathan, really, for being here and for the work you do. And every physician, every healthcare professional needs to read your book for sure, and get more into this mind-heart connection. So thank you so much. Really, really appreciate it.
My pleasure. Thank you, Johannes.
Thank you.
Bye.
We're going to be back in make it 2 minutes with a fun presentation. I promise you. You don't want to miss that one, because Victor Zadi is coming next, and he's a great speaker, very inspirational. So see you back in a minute, 2 minutes. Hello, everybody, wherever you watch or listen in worldwide. Our next speaker is internationally known and from a great country, from Mexico. And I want to introduce, first of all, Victor SAADIA before I introduce him properly. Hi, Victor, how are you?
Hello, Johannes. I'm so happy to be here. Thank you so much.
Oh, thank you for being here. And I think we met in Qatar early this year also, and you had a great presentation there. And I said, yeah, you have to join us here and inspire everybody around the world. And part of this, I think I said that many times, part of what we try to do with the summit, because online we can't bring everybody in from wherever they are, really also show, well, how is lifestyle medicine practiced in Mexico, for example, and what is your message? So thanks again.
Thank you. Like so many people, we met online first, and then when we met them in person, the whole experience changes. So thank you so much.
Absolutely. So Victor is a health and wellness entrepreneur, an author, consultant, speaker, and podcaster. He holds a bachelor degree in economics and an MA in interdisciplinary thought from New York University. Founder and executive director of the Mexican Association of Lifestyle Medicine. Published research papers in education, other philosophy, and other sciences, and I think I remember when we talked, you said, I'm not a physician, but that's a big advantage for me because I bring a different perspective to lifestyle medicine, which I totally agree, right? Very important. And so stage is yours for 20, 25 minutes, and then we have a Q&A at the end.
Thank you. Let me know when you can see my slides and I'll start. Good to go. Great. So, what do you feel when you read this? What do you feel when you read this? You know, doctors and other health professionals are trained to mask their emotions. To act professionally is to show that you have mastered the game. Not only the game of medicine, but the game of life. But how will a patient trust a doctor if the doctor does not show its patients that he's in control? In control of medical knowledge, medical tools, even in control of medical outcomes. He must show he's in control. Of course, we will choose the surgeon who has performed thousands of surgeries and has perfected his knowledge and tools for years. But what happens when the health professional is not dealing with a sedated patient in a gurney on which he will perform a mechanical intervention in the patient's body, but a patient who is thinking, feeling, and moving through the daily affairs of life? In other words, what happens when a doctor wants to influence behavior? Can the doctor claim the same knowledge, use the same tools, and provoke the same outcomes to different patients? Can the health professional expect to make some transformation by only conveying information? And even more, can he or she claim any authority over her patient when her own life is not solved? It is clear that patients and colleagues are not buying it. No doctor or health professional has her life all figured out. When we are children, we believe that all adults have their life figured out, doctors included. But every adult knows that no other adult has his life figured out, doctors included. And yes, the weight that doctors are carrying is too much. Not only they have to carry the weight of changing people's behaviors and life, but in the process, they cannot show that they themselves don't know exactly how to do it. You all know here that since medical school, doctors cannot show signs of weakness and doubt, because doctors who doubt are out of the race to become doctors. Sometimes medical students who want to become doctors and want to rest or want to eat well or want to de-stress during their studies and to be better fitted to attend to others while studying, while in their residencies, while practicing, are left out of the race. If you rest too much, if you take enough care of yourself by eating well or by going outside for a meditation, you might be left out of the race because it might be shown that you are a bit weaker than the others who can support more pain. So if you're a health professional or a doctor especially, how many times have you had to sacrifice your lifestyle? And please note that this is not an error in the game. It is the design of the game. If you're a doctor and you are here with us today, how much have you internalized the fact that in medicine, no pain equals no gain? How ingrained is your belief that to be a good doctor, you have to sacrifice? Sacrifice your relationships, your health, your life? I am not saying this to add more burden to you. It is just to acknowledge the burden that has been imposed on you by the system. And also the burden that you impose on yourself because you have internalized this truth. And this burden that you cannot even share with others because it would show signs of weakness and you are still afraid you'll be left out of the game. But now I ask you, if you're trying to accompany patients into behavior change, how can you do it if you are not permitted to be transparent about who you are and the difficulties of living in a rushed and complex reality? How will you accomplish it if you try to convey simple things when you know that behavior change is one of the most complex things in the universe? You know it. You know that behavior change is complex because you have felt it. You feel it every day. Tell me, what happened that time when for a second, and just with a single patient, you allowed yourself to be honest, transparent, and vulnerable as a health professional with a patient? Don't you remember that consultation perfectly? The impact it had on you and probably on your patient too? How many times have you felt that being vulnerable and open in the clinical setting enhances the level of engagement with patients, lowers burnout levels, and begets better collaboration with colleagues and patients? And when you allow yourself to be transparent and vulnerable, how many times you felt that your healthcare organization becomes both a happier and a safer place? What happened that time when you let your patient cry in front of you and you allowed yourself a tear of empathy instead of just sending your patient to the psychologist or psychiatrist? You see, even the stock photos of crying health professionals seem fake. But anyway, wasn't that tear healing for your patients and to you also? And to the world at large? I think this is a very important question. How can we practice medicine, any sort of medicine? How can we practice medicine or just continue to being alive if we do not cry? How can we heal anything, our bodies, our minds, our spirit, our society, our financial system, our planet, if we do not cry? When you allow yourself to be vulnerable, you are not only offering empathy, but shifting healthcare responsibilities back to where they belong, to the larger team, including the patient, instead of placing the entire burden of responsibility on the back of a single professional. That is being vulnerable, distributing the responsibility. Extensive research from fields like business and entrepreneurship are showing the benefits of vulnerable leadership. How much longer will it take you as a doctor, as a health professional, to get this, to give it a shot? What is it that you don't want to feel? How afraid are you to say, I don't know? How liberating could be for you to show others, like patients, colleagues, relatives, followers on social media, that you're also struggling, that you don't have all the answers? How transforming can this be to them, viewing their doctors, their superheroes, just as fellow humans? I know that what I'm saying now can be obvious for some, but unfortunately, this is something that we should remind us every time. This presentation is not for you to learn. that being vulnerable is good for you, your patients, your practice. It is for us to take a moment and examine the areas of our lives when we are not practicing this. This is why I took this half an hour to allow us a time just for reflection, not for putting more information in our brains, to give us the permission to feel, to give us the permission to share our feelings. Because if we don't give ourselves permission and we carve time in our agendas to do so, believe me, we will keep on the same track, just cramming more information in congresses, in consultations, and all the things that we are doing for productivity. Because talking about vulnerability, a lecture about vulnerability, is not the same as practicing vulnerability. And only you know how much of this vulnerability you are allowing yourself or not. Only you know how much more of this is needed or not in your professional and personal life. And this is a time for you to feel it, acknowledge it, give it space. What burden are you carrying all alone? Please think about this so that you can share it with everyone once my slides are up. What burden are you carrying all alone? What experience of vulnerability has given you more hope to keep experimenting with it? And let me ask you, have you during the 15 minutes of my presentation so far felt my heart? My heart, Victor's heart? Even though I haven't really shared a single thing about me? That I haven't shared the fact that I am not a doctor, not a psychologist, and I'm not even a health professional. And now that you know this, how does this piece of information change your perception of me? And if the perception has changed, how much of this is exactly what you want to avoid with your own patients? What part of you are you hiding? I'll ask it again. Now that you know that I'm not a doctor, not a psychologist, or a health professional, how does this change your perception of me? And if the perception has changed, how much of this is exactly what you want to avoid with your patients and colleagues? Yes, we are all afraid of vulnerability. If you feel a bit uncomfortable, it's part of the game. Vulnerability invites this feeling. I am uncomfortable right now. I'm not sure how am I doing with my slides. But that is exactly why and how it works. Because it puts us in a special place, being uncomfortable and in uncertainty. We all know here that health is much as about what to eat, how to move, how to sleep, how to do things. But it's also how does it feel to do or don't do those things. It is about habits as much as it is about that we think we belong or not, that we are afraid of dying, if we believe we are enough or not. You know, I can't wait to finish my presentation and just ask Johannes, did you like it? And I wonder, why do I need that answer so badly? Do I don't feel enough as of right now? How much do you allow yourself for these fears to be observed and talked about in your daily routine? Now I want to invite you to share your story, even by chat or whatever means, even if it's only with you, with yourself. We were allotted 30 minutes for this conference, and as I said, I'm not here to teach anything new. I'm just here to provide a space where we can reflect, where we can share, where we can take advantage of this gut feeling that this is an invitation for us to keep opening our hearts, opening to who we are, and that we sometimes neglect or mask or just postpone to later. At some point in our life, we'll deal with that. Can you not wait until you feel ready to share something and just share it now? Also, how much of your experience as a health professional can help others experiment with being vulnerable in the clinical setting? That's also a very generous thing to do. So I invite you to share however you feel comfortable, to share these experiences, share your feelings. And we'll see that even in the 8 minutes that we have left, it's the same with consultation and conferences because they are short in time span, but that does not mean that they cannot be profoundly transforming. So even though we have a few minutes, we can go deeper together. I am now shutting down my mic. And if no one wants to speak or share, that's perfectly fine, because then we will learn also from the silence that we are all creating between us. Thank you so much for having me. And we have a few minutes to keep sharing.
And on purpose, I wanted just to have a couple seconds silence, which I think many of us are not used to, right? And we get like busy in our heads and shut down. And so maybe even towards the end, we do this again a bit longer. Let me see. So please type in the chat box if you want to share something, if it's okay to be vulnerable, okay to express what you think, the thoughts come up. Being authentic is high vibration. What would you say with that about that, Victor?
I think authenticity is the most of the things that are most elusive. Like we think we know what it is to be authentic, and the moment we are there, something else pops up in our field of consciousness that we can also explore. And yes, that's exactly why it creates so much energy, because it's the seeking of our authenticity just is a flame that keeps regenerating. And the more we share it, the more afraid we are, but at the same time, the more secure we are. It's like a paradox.
That's incredible, right? I totally agree with that. Let me see, there's a question or some sharing here. I speak as a physician. Several years ago, I experienced significant workplace bullying. What I discovered was how healing my vulnerability was for my patients. At the most difficult time of my life, they grew from giving back. And for this, I'm eternally grateful. Well, thank you so much. Great sharing. Another one here, I agree that allowing patients to cry and give them the space to share their emotions with no judgment gives them a release and builds the trust factor between us. Very good presentation. That's
Thank
for you, Victor.
Thank you. And guys, I hear a lot of health professionals not sharing enough of these vulnerable experiences because they are also very afraid, not of the judgment from their patients, but from their colleagues, their other doctors, their fellow team members. And I would invite everyone to keep sharing with their colleagues, because everyone has these experiences, are afraid of sharing them. And as long as we don't normalize this between us as caregivers, then the delivery to our patients will be incomplete, because we would just show part of our vulnerability to this part, but not to this part. And then we will feel like cut in the middle.
Yeah, I never forget when Dr. YAMANI, when he joined us at the LPU, said, because we're teaching like being present, which I think it's a tool, right? To be more with the client, to be open to sharing whatever comes up at that time and have that as a guiding light. And he said that changed like 100 or 500% the way he interacts with his patient. And the patients, they felt it right away. Something is different with him, right? Just being there, not cutting it off,
Yeah. The other thing that is very recommended, that usually health professionals don't do a lot is share their own struggles with their own health issues or scares or cancer, or just by sharing the story, there's a transformative and healing element. It's not that it will also improve the relationship and it will give better insights and will make more confidence between the health professional patient relationship, but just that empathic connection between our hearts is healing in its own right, and just for that reason is needed.
Wonderful, absolutely. Let me see if there's anything else in here in the chat box here. And an empathetic, vulnerable physician meets my needs much more than a physician with an authoritarian persona. I want to be felt and also understood. Victor, I mean, you work a lot with physicians, right? In different formats, different ways. Is Mexico or from other countries, right? Different cultures. Is there a difference, or is that something that is just part of the training as a physician? I think like Dr. Fisher was talking about and others. Is that just internationally a trained behavior?
Yeah, thank you for the question. And I've seen this across the board, all over the world. The training of health professionals, especially for physicians, is a traumatic experience, very deep traumatic experience. And I sometimes, with a lot of respect and humility, see a lot of doctors from a lens of they might be living through PTSD, post-traumatic stress disorder, because a lot of their personality was formed in those formative years. And not only emotionally they were traumatized, but also there wasn't really any conversation about trauma and about those things. And those things were normalized as this is the only thing that will make you a good doctor, which is paradoxical because things that affected your own health were part of making you a better health professional or healthcare person. So how something that makes you sick will make you better to attend to sick people? And that's a paradox and a cognitive disassociation many health professionals grow up with. So I've seen it across the board. There's definitely much more awareness about these things, but there's a lot of shame and a lot of the belief that the identity of the health professional is the strong here in the room. So we are not allowing ourselves to show that vulnerability, to break down, to show that we don't have all the answers, that we have to heal of that trauma. And that's why I wanted to take this space to talk about this, because it's obvious for many of us, but still there's a lot of these things needed in this ecosystem.
Absolutely. You know, Dr. Fisher actually before was talking about that. He growing up with his dad, like 7 kids, all became doctors. The dad was like a country, what do you call it? Like, the old style doctor that we all want to have back. And we calling that also healthcare 1.0 was the small, decentralized, personal city doctors that they knew the patients, right? And so they had this connection. And healthcare 2.0 is like what we have now, right? The big centralized places, big clinics, and very structured, and all the problems we have. Do you feel like both can be combined, that we still can keep the technology and grow and expand, but bring that countryside heart doctor back?
I don't only think that it can work, I think it's the only way that we can move forward as an integrative ecosystem of a healthcare ecosystem, a healing ecosystem for the planet, for the society. It's difficult because these are identities which we don't know how to deal with in terms of managing different facets of who we are. But we are thinking beings, feeling beings, spiritual beings, energetic beings, social beings, even financial beings, and put everything at the same time, on the same box, on the same consultation room is not easy. We have been taught to separate in different facets. But I think, and this is a bold statement to say, but I think that the next generation of humans depends solely on this of appropriating all the beings that we are at the same time, and trying to behave as if taking care of all these identities that are part of who we are as individuals. And this is good for being a health professional, but also being a business person, a parent, an entrepreneur, a politician, certainly. So yeah, it's not easy because we have been segmenting our beings, but I think progressively we're trying to do so. And your conference is just an example of that, because we're seeing holistic beings presenting things, and not only through a specific lens of, oh, now I am a doctor, now I'm a lecturer, now I'm whatever. We are all allowing ourselves to bring all of who we are to what we do.
Yeah, I totally. I mean, that's what the summit is about. And as we talked about that too, right? We need to come together. And I think many that watching, physicians, healthcare providers, general public, whoever is attending, they see there are other ways of thinking, right? They get inspired, and then hopefully, and I want to ask everybody, right? Be inspired and share, and most of all, though, Victor, what do you say? Focusing on our own habits, improvements, lifestyle, growing ourselves, is that the priority?
I think it's a big question to answer, but I think that there's enough magic in lifestyle that when you take care of yourself through your lifestyle, automatically it's like taking care of others, of patients, of colleagues, of family members, even of the planet, because we know that healthy behaviors in terms of lifestyle are also good for society and also good for the planet. So thinking about priorities might not be the best way, because then we are categorizing and we're thinking that one is before the other. But it's instead seeing the magic of taking care of yourself through these principles, at the same time is taking care of the ecosystem. And that's a beautiful thing to see also.
Thank you so much. Really appreciate it. Thanks for being here and spreading this message. So really appreciate it, Victor.
Yeah, I thank you and I honor you for this huge work that you take on. Thank you in behalf of all of us. And yeah, it's a pleasure being part of this community. We're so much love that I cannot really explain. I'm just here to feel the love that we are. So thank you, my friend. And thank you all.
Thank you so much, everyone. We're going to be back with our last speaker. Please come back in a minute. Quick break and great conversation and talk to be looking forward. Hello. Welcome back. Our last speaker is Dr. SHAGUFTA FEROZ. How are you? Good to see you.
Hi, Johan, how are you? I'm good. And I'm very glad that I am part of this. Finally, I've joined this summit. And I would like to appreciate you, the amount of work you do, we can imagine, because we organize conferences. And it is commendable. It is commendable. But one thing which I am appreciating about you, that when you conduct a virtual conference, you absorb a lot of information, which we don't when we do in-person conference, because we are going in and out of the hall and we are missing a lot of the presentation. So you are lucky that you are being enlightened during these lectures as well. So all my
Yeah.
best wishes for you.
Oh, thank you so much. And but the good thing is, I think we need a lot more local conferences because that's the personal touch. It's just still a bit different doing it online, but the advantage obviously is we can be anywhere, anytime from around the globe. Someone can join and really learn. So that's our mission, our goal.
Yeah,
So
that's amazing.
let me introduce you quickly. So Dr. Feroz is director of the Rifa Institute of Lifestyle Medicine, president of the Pakistan Association of Lifestyle Medicine, a private medical practice since 1988. I hope that's correct. Lifestyle
Yes.
medicine leader, speaker at many different conferences, and you've done amazing work already and a lot more to come. And you talk about the how of eating, turning table food into remedy.
Yeah. Yes.
Great topic.
Yeah.
Here we go.
Because
So you have 20, 25 minutes, and then we
Okay.
come back for a Q&A.
Okay. Okay. So this is me, and I am part of all the whole food plant-based movement promoting organizations. So I'll be talking about the how, because we know we have information through these digital medium about healthy foods, but I don't think we know the protocol of consuming those healthy foods. I have nothing to disclose. I don't have any connection to any drug or products. So what are primarily the objectives? Why do we need healthy whole food plant-based diet? What is dietary discipline? And entrainment. Entrainment is the key to health. So these are the three areas which I'll be touching during my presentation. I like this quote. Food is the most widely abused anti-anxiety drug in America, and exercise is the most potent and underutilized antidepressant, which is true. We all know that. So medicine, sorry. Again, we all are familiar with this quote that medicine is not, sorry, medicine is not healthcare. Food is healthcare. Medicine is sick care. Let's all get this straight for a change. Okay, so why of whole food plant-based diet? We should know first why, and then we go into how. If somebody is struggling with their weight issues or they are having health issues, they need to scan their diet, what they are consuming. If their disease is not under control, despite having best medical treatment, the ratio of the different food groups are imbalanced in their meal. Then the sleep quality and quantity is connected to the type of food which you are consuming. If there is speedy mental aging, I hope you all are familiar with the three kinds of aging. One is chronological, biological, and mental aging. So if the food is not right or it is not consumed in a disciplined manner, there is speedy mental aging. If there is dependence on smoking, sedatives, shisha, or alcohol, or any other drug, definitely you are not consuming whole food plant-based diet. your behavioral disorders are also connected to the type of food which you are consuming. You all are familiar that we all hear that you are what you eat, but I have just modified this and I say that you are what and how you eat. Food needs to be digested, absorbed, assimilated, and excreted. Only then you can say that you have consumed a healthy food which is properly broken into its nutrients which are supposed to help your body systems. Therefore, besides whole food plant-based diet, dietary discipline is crucial for vital force, positive health, and longevity. I have intentionally touched only these three areas. Rest, I think all of us know what are the benefits of a healthy food. So, why food is vital for our life? For me, this is an important area of our body which we normally ignore, that how body is rebuilding or repairing itself in less than 365 days. If you go through, for me in this slide, DNA, your DNA renews itself after 2 months. So you can imagine the importance of renewing of DNA. Then stomach lining. The lining in your stomach rebuilds itself in 5 days, all happening because of the healthy nutrients if they are readily available in the bloodstreams to do all this. Then the brain rebuilds itself in 1 year. Your blood rebuilds itself in 4 months. Bones. So your body builds a whole new skeleton in 3 months. So you understand the importance of the right amount and right uh, kind and right combination of the nutrients. This is an important slide also. I love this slide. If our foods are not absorbed and they are not, because food is not working only at the physical level, the food is holistic also. We are holistic beings, like Victor was talking, and everyone, Bruce Lipton also talks about the holistic being. So food also has got three elements. It is chemical, it is energy, and it does help in our emotional being also. But this is amazing that as the voltage drops, that means if the right kind and right combination of the food is not given, the cell is unable to maintain a healthy environment for itself. If the electrical charge of a human cell drops to 50, a person has chronic fatigue and gets sick often. If the voltage drops to 15, the cell becomes cancerous. And this was presented by Otto Warburg, who is a Nobel Prize winner. So that is why the consumption of food is important, that what we are doing to our body. Another important aspect of the food, that we should target that whatever food we are consuming, it should be energizing our spiritual being also. So the food has got, because again, we are at subtle level or at physical level, our body is regulated by chemicals. At emotional level, our body is regulated by electrical currents. At a spiritual level, the body is regulated through electromagnetic currents. So the food also has got all three properties. So we need to extract these three abilities of the foods which we are consuming. So this is my opinion, that what are the missing keys in whole food plant-based movement? We don't bother about the quality of foods. Yes, all of us, it's a very impressive and powerful movement, and people have shifted to whole food plant-based, but we never bother about the quality of food. We don't know which food is compatible with which group of food. Then a few other dietary disciplines. We don't care about biochemical individuality. I can tell you about myself. While consuming whole food plant-based diet, I can't consume greens, a lot of greens. If I consume green leaves, they give me flatulence. So I prefer consuming lentils, beans, nuts, seeds, but not greens. So it all varies. The biochemical individuality forces us to consume foods which are compatible to our body type. So if we are not focusing on the quality of food, all these snacks are plant-based. So what do you say about these plants, these snacks? Are they healthy? No, these snacks are not healthy. Because why they aren't they healthy? The reason is, and you all know that we are being dodged by the beautifully impressive marketing techniques for whole food plant-based, and we are consuming actually ultra processed foods. You just can have an example. This was a study done somewhere in US. You can see that the French fries, how come the French fries are the same after 1 year? The reason is they have got so many chemicals which are there to prolong their shelf life. I think we all are familiar with the list of these chemicals which are present in ultra-processed foods. Refined sugars, high fructose corn syrup, trans fats, most lethal ones are trans fats. Then rancid vegetable oils, white flour, a very, very common ingredient, additives, MSG, Ajinomoto, artificial flavors, artificial colors, protein powder, soya protein isolate, artificial sweeteners, preservatives, nitrates, and nitrites. So I'll go a little more about the trans fats. See what trans fats are doing in our body. They lead to atherosclerosis and heart disease, cancer, degeneration of joints and tendons, osteoporosis, diabetes, obesity, autoimmune diseases, eczema, psoriasis, premenstrual syndrome and menstrual problems, lowered testosterone, lowered sperm count, failure to grow, learning disabilities, low birth weight babies, reduced visual acuity, reduced fat content in mother's milk. So you can imagine we might be feeling very proud that we have changed our lifestyle and we have shifted to plant-based meals, but we might not be careful about the quality of the food which we are consuming. So every cell in your body is made from the food you eat. If you consistently eat junk food, then you will have a junk body. I like this Michael Pollan quote that don't eat anything your great great grandmother wouldn't recognize as food. The whole food plant-based diet will be a remedy for everyone if source and medium of cooking is natural, method of cooking is simple, and food is body compatible. You are able to digest, absorb, assimilate, utilize, and eliminate that food fully. Before I go into further details, I think we need to understand the definition of a balanced diet. The definition of a balanced diet varies from person to person because everyone is biochemically unique and have their own sets of food likes and dislikes. The balanced diet varies throughout life as individual chemistry changes. It is dependent on age, gender, body type. We have two broader classification of body types. One is parasympathetic predisposed and the other is sympathetic predisposed. Level of physical activity, stress conditions, nature of work, changing seasons, weather conditions, emotional and spiritual states, even the identical twin. And this is my experience, by the way. In my clinic, I have observed that if I get a chance to see identical twins, their food choices vary. If I'm trying to add more plant-based diet in their meal, one will like go for nuts, the other will go only for grains. They won't like lentils because there are, though they are identical twins, but still their chemistry varies. So why we need to understand the how of this whole food? Because why? The reason number one is the most important reason. We are biochemically unique. Circadian rhythms. We have to respect our sleep wakeful cycle, homeostasis regulation, and microbiome. How can we ignore our microbiomes? We can't overfed our microbiome because the vegetables, they have got prebiotic. So we need certain amount of prebiotics to keep our microbiome healthy. But how? So these are the main reasons that we are supposed to know about. So little more about circadian rhythms. The circadian system composed of a set of interconnected clock oscillators located in the suprachiasmatic nuclei of the hypothalamus and in some metabolically active peripheral organs, which regulates the behavioral and psychological daily rhythms of sleep slash wake, fasting and feeding, and catabolic and anabolic cycles, body temperature, and endocrine functions. So these circadian rhythms are regulating quite vital functions of the body. So how can we disrespectful to the circadian rhythm while consuming whole food plant-based diet? The circadian rhythms in liver are highly plastic and can be remodeled by external environmental factors such as feeding time. So that is why time is important. Diet and internal pathophysiological signals, including cancer, microbiota, and aging. I would like to add here the lung cancer, for its metastasis, needs to switch off 46 genes in liver which are connected with circadian rhythm for its metastasis. This requires integration of the central clock in the suprachiasmatic nucleus with the clocks in the hepatocytes and non-parenchymal cells, which is influenced by environmental signals including light, dark, and feeding fasting. In addition to the traditional transcriptional translational feedback loop that comprises the core clock, non-canonical regulators, which are sometimes triggered by diet or other factors. These non-canonical regulators are the abnormal chemicals, I'm just simplifying these, are the abnormal chemicals which are produced in the body when we don't follow any dietary discipline, when the healthy food is converted into toxicants, which are sometimes triggered by diet or other factors, may also regulate the rhythmic expression of hepatic genes. Moreover, cell autonomous clocks in hepatocytes and non-parenchymal cells control intracellular time signals. So for liver is the most important organ which follows circadian rhythm. And we all know that liver is not as simple as we doctors have taken it. And by just getting LFTs done, we think that we have assessed the whole liver. Liver is approximately doing 500 functions. So we are not assessing actually the real health of liver. All these clocks are interconnected and interdependent, and they are dependent on the feeding time, the way we consume our food. What is entrainment? Entrainment is the alignment of your external routine with ongoing inner rhythms. So this is what is entrainment is all about. When your body clock is desynchronized, immunity is affected. There is speedy aging. There are behavioral disorders. There is depression, OCD, fears, grief, constant digestive complaints, hormonal imbalance, sleep deprivation. In the recent past, a doctor was telling me that her husband, who is a gastroenterologist, he was suffering from GERD, and his son who is responsible in US, probably New Jersey, somewhere in a hospital, who's responsible for the intensive care or IC unit. He also had ulcers. And their newborn baby, who was only, I think, 8 or 9 months old, the baby was also having GERD. So this stomach disorder is not simple to fix if we don't know where the problem lies. Then hormonal imbalance and sleep deprivation if we are not connected to the circadian rhythms. So a growing evidence highlights the importance of the biological clock as a modulator of energy balance and metabolism. Recent studies in humans have shown that ingested calories are apparently utilized more efficiently in the morning than in the evening. And this is manifested through improved weight loss even under isoenergetic calorie intake. So this research proves the importance of a early, healthy, tummy-full breakfast. So meal timings are the key to whole health. Eating breakfast affects our body's biological clock or circadian rhythm, which helps us get ready for quality sleep later in the evening. This is such a beautiful part. Whenever I see patients whose sleep is disturbed, I always fix their breakfast in the time bracket which is determined by the chrono nutrition, which says that the breakfast time is between 5 a.m. to 9 a.m. So by bringing the breakfast in that bracket, gradually starts fixing their night sleep without any added drug to their routine. That means preparation for a good night's rest starts shortly after the morning alarm. So these are the, sorry. Actually, these are the 8 rules of correct eating, which are part of my clinic or my practice. So selection of natural foods. So whenever you look for whole food plant-based, you should be clear that it is natural. Timings: breakfast should be before 9 a.m., dinner should be before 9 p.m. The lunch bracket is around 12 to 2. So don't eat beyond the brackets. The digestion is optimum if you follow your circadian rhythm. Favorite food should be selected because just to cater your biochemical individuality. Mindful eating. Don't put any devices on the table while consuming food. Don't grab your sandwich or coffee while going to the office or while driving the car. So mindful eating is very important aspect of this correct eating or dietary discipline. Then correct food combinations are important. We have to combine acidic or alkaline foods together. Like in whole food plant-based, there is a group of foods which are acidic. You have to combine the acidic and alkaline plant-based foods just to keep the pH of the blood close to 7.35. We can't play with the homeostasis. Then food rotation. Excessive consumption of one food can lead to shift in the pH, and whenever there is a shift in the pH, it leads to start of the inflammation in the body. Then food temperature is important and correct water intake. So this is just a chart where you can get an idea about the acidic foods and the alkaline foods for proper combinations. Then food temperature. You know that we are in a habit of taking chilled water and warm foods together. This gives a thermoshock to the body because internal body or internal organs, they work in a narrow window of about 98.4. So the internal temperature is important for the vital functions of heart, liver, brain, kidney, even circulation. So how can we afford to have ice cold water and the soup in our meal together over a short period of time? So temperature is extremely important. food rotation. Rotation is important because when we rotate foods, we avoid accumulation of one type of metabolites. And according to Cleveland Clinic, we get more nutrients. It is for longevity. It decreases risk of metabolic syndrome or to lose in inches. Food preferences are according to your body type or your biochemistry. Then correct water intake. We even forget to hydrate ourselves. I don't know. I don't know how many of you drink by counting glasses of water, and you drink around 3 liters of water. So quantity is important. Water should always be taken before meals and never take chilled water. Try to take water at room temperature. If you are in a cold environment, try to take water which is warm because it helps in many things. So drinking enough water each day is crucial for many reasons: to regulate body temperature, keep joints lubricated, prevent infections, deliver nutrients to the cell, and keep organs functioning properly. Being well hydrated also improves sleep quality, cognition, and mood. It makes your blood less viscous. These are the very, very simple precautions which I don't know but we don't follow. So my practice is based on predominantly whole food plant-based diet, where I do encourage consumption of pasture-raised eggs, and I use bone broth for immediate energy building or energy enhancement. So this is all about my presentation. I have shared the links of 2 websites. Anybody interested in going into more details, you can get an idea to organize your day, what intervals are important and what combinations are important. You can get an idea from the website also. So thank you. Thank you very much.
Thank you so much. That was absolutely amazing. And you know what I love about it is not just what we eat, but how we eat.
Yeah, yeah.
Did you find that that's maybe I don't want to judge one or the other, but it's like at least equally important, the how versus what we eat.
Yes, yes. I can tell you, I can just tell you my experience with my patients. This was taught to me when I was doing my holistic nutrition PhD. This I learned there. But what I learn in my patients, that a lot of patients are conscious now and they are using their homegrown foods, but there is no discipline. They are combining, like, and I can tell you, taking coffee right after whole wheat bread and egg will make a lethal combination, which we normally do. So combinations are important. And when I simply organize their food, they start showing results within, I think, 2 or 3 weeks. Because you are decreasing the load of those metabolites in the blood which are not healthy for the body, and probably they are leading to inflammation.
So combining the food, how we eat, that's amazing. Can compatibility of food with body varies from person to person? Question from attendees.
Yes, yes, it varies. It varies. Because we are not carrying identical chemistries also. We vary in our chemistries also. So the compatibility of food also varies.
Another question. Let's just say I don't have access to someone like you that is really experienced. Can you give a couple, I mean, you did already, but fine tune like the 2 or 3 top tips, guidelines that can help the patients or anybody watching? How can I do this? The combination, what should I look at, especially with the combination of food?
Okay, okay. Number one, the major point which helps us aligning with the body clock is the breakfast. So I always say celebrate your breakfast, enjoy your breakfast, and include all those foods which you love to eat. Listen to your body. For me, body is very sacred. We are not connected to our body. So if we start listening to our body will guide you about the combinations. But I can generally give you an idea. All those, it's difficult to explain, but the body type which is sympathetic predisposed, like individuals who carry a hyper kind of body type, they should not have these caffeine-based drinks combining with their food, or they should always have caffeine-based drinks separately. Don't take them with the food, number one. Number two, don't drink water after the meals. It is also a bad combination. So water should always be before the meals to facilitate the stomach with its concentrated acid to digest the food. Similarly, if you want to drink something sweet, like if you want to have some drink or juice, it should be prior to the food. Because if you take it right after the food, right after a major meal, there will be sugar spikes, and sugar spikes in one meal twice are not good for for your health. It might lead to the release of cortisol. So water before the meals, listen to your body, what are the favorite foods, but those favorite foods should have natural origin. If somebody says that I love to take sausages, then those are not have natural source.
A good point, actually. What about, which I hear in different cultures, especially like meat or a lot of fish that's been eaten in terms of plus plant-based? Are there some tips if you combine these type of proteins with plant-based?
Okay, because we now talk about predominantly plant-based diet, which means 80% of your plan should have plant-based, and only 20% you can consume any meat of your preference, but beef is not recommended by American College of Cancer Institute of America. They say that it should be consumed only once a year, once a year. So for me, fish is the safest option if you want to consume. And then comes the chicken, which is again pasture raised, because there is a lot of confusion which chicken we are going to consume. So these are the two kinds of proteins which are safe if you want to get protein from the animal source. Eggs are the bestest form of protein, by the way. The highest BV value, biological value, eggs have. They have even proteins more than beef. So eggs are safe to consume.
And yeah, well, and then I think it's a bit complex because we hear so many things, right? And then so eggs now, I mean, then how many? And there are probably a lot of questions, right? But what's that is there moderation really the key,
Yes.
or yeah?
Rotation. The principle there was
Rotation.
rotation.
That's a good one.
So rotation means don't have eggs daily. You can have only eggs twice a week. So all the food groups should be rotated, and they should not be more than twice in a week. If they are more than twice in a week, there will be accumulation of their end products, which will shift the pH and inflammation will start.
What about intermittent fasting, which is obviously huge, right? And talk about the importance of having a strong, healthy kind of breakfast and enjoy that. What would you say a guideline on intermittent fasting,
Okay.
if at all?
Yeah, intermittent fasting is good to do, but what I do, because I can't be disrespectful to the circadian rhythm, because this is innate mechanism which is there. So what I do, I follow 16 and /8 pattern, but I ask them to have their breakfast, then they can have their food after 8 hours. They can eat in 8 hours window, and then they can follow 16 hours fast, which will start around from 8 or 4 p.m. onwards. So I just change the time slot to make it aligned with the circadian rhythm. Then it works. Then it becomes safer, because the people who were on intermittent fasting, they normally eat at 8 p.m. at night, and then their breakfast comes at 12 noon. So the people who were on this kind of intermittent fasting, they have shown some rebound phenomena in their weight, and even there was fluctuation in their sugar levels. But when you become close to circadian rhythm, you get less side effects of this intermittent fasting.
Absolutely. Makes sense, and my experience too. So one more question. So I've been kind of over time. I hope you don't mind, because I'm it's really interesting, and I'm picking up questions from the audience. This is my question though. At our university, Lifestyle Prescription University, we work a lot with the autonomic nervous system, right? With the sympathetic and parasympathetic mechanisms in our body, which run a lot of our unconscious body functions and so on, right? I haven't heard too many talk about that in connection with nutrition. Can you elaborate a little bit? Because I so agree with you on that. That is something, you know, we need to consider. Like you said, somebody that is mostly sympathetic, higher stress level and so on, versus somebody that is more parasympathetic, more fatigued and so on, right? The two differences. Can you talk a bit more about that?
Okay. So by default, we don't have the choice to develop a predisposition. So by default or by birth, we have two types. One is parasympathetic predisposed and the other is sympathetic predisposed. I always forget the classification name, but it is, I think, I mentioned this in my book. Hexa something is the name of this classification. I will share with you later on. So the people with sympathetic predisposition, their appetite is bigger and their digestion is good, right? They are more into sugary foods and they don't want spicy or savory food. These are the typical characteristics of people who are sympathetic predisposed. People who are parasympathetic predisposed, they prefer to take savory and salty foods. The reason, what is the underlying reason? This is actually the autonomic setting is going on. The body is trying to regulate the homeostasis of the body. And what are the areas where what are the areas which body is trying to fix? Number one is pH. Number two is the glucose level. Number three is the core temperature. Core temperature is something so vital to us. So the body forces us to have something to balance these three areas of our life so that we are in a perfect survival mode. Those with parasympathetic predisposition, they have smaller appetite, but they indulge into various kinds of nibblings. These are the people who go into addictions, food addictions even, or other kinds of addictions. So it becomes easier if you classify the body type, then it becomes easier to write a prescription for that person.
So interesting. Thank you. Thank you so much. This is really amazing. Let me see if I find one last question, if you don't mind. What about grass-fed, pasture-raised beef? Because that's the big thing right now. I mean, especially in the keto world and so on. You know, a lot more protein, and that's in the US at least super popular. Talking about /evidence-based, right? But is there a difference if it's grass-fed and I guess no hormones? And that obviously is a lot better than just not very good, full of hormone kind of beef or fish or whatever, right?
Yes, definitely the grass-fed pasture-raised beef can be consumed in very, I would say, in moderation. Though a lot of researchers are not in favor of consuming beef regularly, but if somebody has got that kind of beef, they can consume it. But definitely, I would say not more than once or twice in a month, if not once in a year. And again, combination. I'll again talk about combination. So somebody is consuming beef because it is acidic by chemistry. They have to consume a lot of alkaline foods, lot of alkaline vegetables to balance the end chemistry or the end metabolite of that beef to make it little safer. This is what I'll be doing. If somebody is insisting me that I want to have beef, then I will give him the beef, but with vegetables which are going to make the absorption and digestion of the end product of beef safer for the body.
And somebody just typed in "living as nature intended." Your book, so a lot of this information is in there, right?
Yeah.
Perfect. So I ask, because the guys Google, or we put it on the website too. You can just Google and if you want to know more, get that book. which is
Oh,
absolutely amazing.
yeah, it's available on Amazon as well. No?
Yeah, cool, wonderful. Thank you again so much.
Good. Thank you.
It's wonderful that you share this knowledge and inspire. I know there's a lot of health professionals in here right now, or the whole summit, and also the general public that just needs, hey, what I going to do, you know? And so really appreciate it. Amazing work. And I hope we see you back very soon.
Thank you very much. Thank you very much. Bye-bye.
Thank you. Thank you. Now, this is the end of day 2, and I want to thank everybody, our amazing speakers. I mean, guys, type in the chat box. Isn't that amazing? We learned so much. Dr. FEROZ was saying, you know, it's the great, like, be here and really be focused on learning and being inspired, and that's our intention with the summit. So a couple things. First of all, type in the chat box and thank Alessandro, which is in the background. He's in the background and managing everything. Amazing job, right? It's running so smoothly. So thanks, Sandro. Amazing. Type in the chat box, everybody. Appreciate him and everybody from our team that made it happen, you know, at Lifestyle Prescription University and a nonprofit, the Lifestyle Medicine University Foundation, to make it happen. And again, thanks for everyone that upgrades to premium, because that helps us to put these events on, as I said before. Really appreciate that. You can still do that, get the recordings. If you scroll down on the page, right, you can do that and just upgrade, get the recordings and really CE credits and many other benefits. And also, if you're interested, many ask actually in the chat, or we got emails, if you're interested in the PhD or we have basically, the university has kind of 3 programs. One is the master's in integrative medicine, integrative master's degree in lifestyle medicine and health coaching. We have the PhD or the fast track, which means, you know, wherever you are, we help you to get to the PhD as fast as possible. Lowest tuition, lowest time, a lot of time saving. Can apply your existing credits and diplomas and qualifications. And somebody asked me, actually, you know, often, like even in some of the accreditations, you have to have a master, you have to have the credentials. And many of you, I know, they've studied for so many years and don't have that. So that's in part why we feel, you know, we developed the PhD and the masters to actually help you get to that level, build up your credentials, and then, you know, play a much bigger role, become a leader in the lifestyle medicine field, which we absolutely need. There's also the Lifestyle Medicine Works banner down there. If you're interested in learning more education, more into lifestyle medicine implementation, we launched something new in January, February next year. Go on the waiting list, add yourself to the waiting list, and you're going to be first to learn about it, maybe even be part of a pilot. We're starting a pilot project where we want to basically find out and do the research, you know, is this working what we're planning, which I think is super cool. And that's it for today. So thanks again so much. We're going to be back tomorrow, same time. The replay is on until tomorrow when we start day 3. Thank you, guys. And scroll down also on this page for the speakers tomorrow. Great speakers. And you don't want to miss Dean Ornish. He's always just grateful that he's going to join us. Thank you again.